afternoon, everyone. I'd like to call the regular meeting of Council to order. Our clerk today will be Ms. Karen Robertson, and I would ask for a procedural motion to proceed in camera.
So
moved, Councillor Thorpe, seconded Councillor Hemmons. All those in favour? Opposed? Motion carries. Thank you very much. Good evening, everybody. I'd like to welcome all of you to the August 31st regular meeting of Council. I'd like to first recognize that we are gathered on the traditional territory, the Snuneymuxw First Nation. And I'd also like to welcome everybody back after the August break. Our clerk tonight will be Ms. Karen Robertson. Tonight's regular meeting of council will be held in accordance with the Community Charter, Council Procedure Bylaw 2018, number 7272, Ministerial Order number M192, governing open meetings during a state of emergency, and the Provincial Health Officer Order regarding mass gathering events. Therefore, members of the public are required to observe meetings virtually and not attend in person, and question period will be suspended throughout the duration of the provincial health orders in effect. And the first item on the agenda is the introduction of late items. Ms. Robertson.
Thank you, Your Worship. It's requested that Council reorder Agenda Item 11A, delegation from MLA Sheila Malcolmson regarding BC's situation tables, to the presentation section portion of the agenda as Item 8B, and to add her PowerPoint presentation and fact sheet, both of which were previously circulated to Council on the addendum agenda.
Very good, thank you. A motion for approval of the agenda as amended. Moved Councillor Armstrong, seconded Councillor Gesselbrock. All those in favour? Opposed? Motion carries. You've all seen the minutes. A motion for adoption of the minutes is circulated. Moved Councillor Thorpe, seconded Councillor Martman. All those in favour? Motion carries. Thank you very much. Mayor's report. I'm happy to announce that during August, a letter was received from Ryan Wainwright, who is the Senior Regional Manager, Vancouver Island Region Emergency Management BC. And it's addressed to Karen Lindsay, our Fire Chief. And I just want to read the first couple of paragraphs because this is an important honor, I think. Dear Karen Lindsay, on behalf of Emergency Management BC, the Emergency Support Services Program, and the Vancouver Island Regional Office, I would like to thank the City of Nanaimo ESS team, and in particular the following members: Ray Hartley, Suzanne Pelletier, Alora Bouvier, Marlene Kennan, and Wayne Hartley. On February 2nd, 2020, they deployed to the community of the Lallt First Nation after a weather event forced 94 community members from their homes. The ESS program is very proud of your team for organizing and stepping up to assist. We would also like to acknowledge the City of Nanaimo's ESS team for the outstanding work and commitment through the countless hours they devote to build and maintain their skills to be prepared to support not only their own community but neighboring communities when called upon. So on behalf of Council, I want to extend congratulations to the team and to all those involved and those whose names aren't mentioned and weren't mentioned here tonight. This is the kind of thing that reminds us how fortunate we are in this city to have such an outstanding team of public servants working for the City of Nanaimo. On another note, and these are public servants as well, I received a letter from Canada Post from Benjamin Berman, who's the Manager of Government Community Affairs BC, and I'm going to read out very quickly the portion of it that's relevant. He said, "Good morning, Mayor Krogh. I'm reaching out to you today on behalf of our Canada Post letter carriers in Nanaimo, many of whom are facing a very dangerous situation due to repeated dog attacks. Year to date, there have been 49 dog incidents in Nanaimo, which is an extremely high number for one municipality. The worst of these happened on July 28th when a letter carrier's right bicep was latched onto, resulting in a significant bite wound." So they've reached out to us to try and remind people that, yes, we love our pets, and some people are a great deal freer with their dogs than others, but surely postal service workers bringing mail to your house should be free from the threat of violent attacks by animals that people choose not to control. I also received a letter from Mr. Gerner from Lake Country, BC, who is involved also with folks here in Nanaimo relating to International Overdose Awareness Day. He understands that there will be lighting the Bastion, which is happening tonight, and we are doing it as a city to honor the fallen and their families who have died as a result of overdoses in this city and in this province and country. He had requested a formal endorsement, and certainly I know Council all agreed to it. He was also concerned, and I say this with some sadness, that a mother in our community was placing ribbons in various places, and a number of those were removed, and I would like to think that that reflected a small minority in this community, as we are all very conscious of those families who have been impacted by deaths due to overdoses. I don't think there's probably a member of this council or a person in this room who doesn't know a family who hasn't been impacted either directly or indirectly as a result. And I also want to say that as COVID continues, and we are all trying to get used to what has become our norm for several months, I ask once again on behalf of Council that, in the words of Dr. Henry, you be calm, you be kind, and you stay safe. We are seeing some businesses in our community face tremendous challenges, placing economic pressure on the owners and their families and their employees. We continue to see significant street disorder and homelessness exacerbated by the very bad drugs that circulate in our community. I note from time to time a certain frustration among people who are getting tired of lining up for everything, even day-to-day items. But it is now more important than ever as we try to work into a school year, which is placing tremendous pressure on those who try and educate our children in our community, placing tremendous pressure on those delivering those services and on families trying to cope with childcare issues and the stress and all of those things. Our police services who face incredible challenges on our streets every day, our own staff who likewise do so. This is a time to be stronger than ever, be more patient than ever, to remember that even though it may feel good to release your emotion in a peak of anger or a critical word, this is the time to show maturity as a community. This province, to its credit, has led the way virtually in the world in terms of combating COVID. And that has not been done without sacrifice and without stress, but it is something to be honored. Our provincial government has shown leadership in this area. Many in this community have as well, and so I compliment and on behalf of Council thank everybody who continues to socially distance, physically distance, wear their masks and personal protective equipment wherever they can. And again, finally, just be kind to each other, and I want to thank Council for the work that they have undertaken to try and keep this city as happy and as prosperous a place as we possibly can as we work through this. It is clearly a situation where there is not an immediate end in sight, even potentially in a year or more, but we are in this together and we're going to get through it. So thank you. I pardon my verbiage tonight, but these are tough times. They're getting tougher for lots of people, and we need to remind ourselves to be conscious of that. We have an item under Rise and Report, and I would like to convey that Council passed a motion at the in-camera portion of today's meeting to rise and report on the following. The first item is that Council appointed Karen Robertson as the Deputy to the officer assigned to the responsibility of corporate administration pursuant to Section 148 of the Community Charter, and reappointed Skye Snellgrove and Laura Mercer until December 31st, 2020 as Deputy Corporate Officers to act in the place of the Corporate Officer when the Corporate Officer is absent. And secondly, Council has nominated Ms. Charlotte Taylor, an outstanding young woman, to be one of the 3 students from the AVICC region selected to receive a complimentary registration to attend the Union of BC Municipalities virtual convention from September 22nd to 24th, 2020. And I'm also now, as we move into presentations, delighted to welcome in order, as they're going to speak, Dr. Mike Benusik, and I trust I pronounced it correctly, our new Chief Medical Health Officer for Island Health, and he'll be followed by Sheila Malcolmson. We've got 2 distinguished guests tonight. This is a banner way to finish up the month of August. Dr. Benusik, congratulations and welcome.
Thank you, Mayor. And it's for pronunciation. In fact, my family members actually pronounce the last name differently, so whatever you would like. But Mike is absolutely fine for everyone, of course. So I am the new Medical Health Officer. My name's Mike Benusik, and I have the tall task of replacing the irreplaceable Paul Hasselbeck as the Medical Health Officer for the area. And I've had the opportunity to connect with a few of you and a few of your staff, but I'm happy today to actually be able to come and speak to you in person as an introduction. And what I wanted to do was provide a short presentation. Hopefully this lasts only 10 minutes. Then we can perhaps do some Q&A depending on timing and the mayor. And what I want to do is just provide for some of you a reintroduction, perhaps some of you might actually be an introduction if you're new to council, about the role of the medical health officer. Because for two reasons. One, for those who are new, might just be a way to figure out what my role is, but it's also a way for me to figure out what my role is and really go through what I see as my vision for being the medical health officer and how I envision working with City Council. Then I'll provide quick updates on the dual public health emergencies, which has certainly already been mentioned, that of the COVID-19 pandemic and the overdose epidemic. And then finish off just with a discussion about how we can work together. I just wanted to include this slide to start off with, just showing what Island Health is. It's a massive organization of $2.8 billion budget with over 23,000 staff and over 2,500 medical staff. And it's just a way of providing a disclaimer to you that it's a massive organization and I may not immediately be the best person to be in touch with about an issue. If it's an issue regarding public health, I'm the person. If it's an issue regarding health care, that's probably someone else within Island Health. If it's about acute health services, if it's about community health services, I can hopefully act as a conduit. If you don't know who to contact within Island Health, that would be one of my roles, but there may be such situations if you come to me with questions or concerns where I have to defer you to someone else. There are 5 medical health officers for the island, and we each have our own geography. So up north is Charmaine Enns. I am in Central Island, which includes the regional district of Nanaimo, as well as the regional district of Alberni-Clayoquot. South of us for Cowichan Valley is Shannon Waters. And then in the south, there is Murray Fife and Dee Hoyano. And then Richard Stanwyck is the chief medical health officer. I'm also on call right now, so that wasn't timed, but I can wait for that one. On the website of the provincial health officer, so Dr. Bonnie Henry, there is a list of what are considered the key roles as a medical health officer, and I picked 4 out of the 7 that I feel, in my mind, best kind of explain what the interface is between the MHO and the community. So the first is the statutory role, and that's really the requirements and powers that I have under the Public Health Act and other laws, be it the Community Care Assisted Living Act, which is about licensing of long-term care, assisted living, childcare facilities, Drinking Water Protection Act, and the School Act. And it really ultimately is there's a responsibility for me to be notified if there's concerns within the community of health hazards, and then a responsibility for me to act and certain powers that are granted. So for instance, when it comes to COVID-19, if someone is infected and at risk of infecting others, requiring them to isolate, for example. Second is population health, so that's monitoring and assessing the health status of the community. And there's quite a robust amount of information you can find on the PHSA websites that really break down anything you'd want to know when it comes to health, be it health outcomes or determinants of health. But what I find is that it's really, all of the information you want will be there, but everything else will also be there. And so I see my role as kind of filtering that out into what I feel is some certain health indicators that could be focused on. And I know that Paul in the past had done presentations whenever there's an update to City Council, and I look forward to providing a presentation like that in the future. Third is that of the community medicine consultant. And the way I think of this is really, a typical physician, their patient would be an individual person, whereas my patient is a community. So if there's questions or concerns about ways to improve the health of the community or certain issues, that I would look to be a part of those. And what I provide is evidence-based opinions. And I really see it as working collaboratively to assist in resolving those issues. The last but not least is advocacy, so that's communicating directly on health issues, particularly ones that may not get as much attention, to the community, to the media, to the board, and to elected officials. So that was a quick introduction on just let's say maybe a recalibration on my role. And I'll go into a status update of COVID-19 on Vancouver Island. A disclaimer is that when everything with COVID obviously moves incredibly rapidly, so these slides had to be submitted last week. So some things are very slightly out of date, and I'll provide an update as we go along. So as I was saying before, when it came to population health assessments, there's an overwhelming amount of information that can come about, and I think that's certainly been the case with COVID. And I just want to provide some perspective on the numbers we just hear about every day, every minute it seems, when it comes to COVID-19. So as of August 25th, there were 170 cases in 170 days, and now it's been about 175 in 173 days. And I'm using the March 11th as when we had the first case on Vancouver Island, which was also the first day that the pandemic was announced as the marker. The population of Vancouver Island is about 850,000, and so we've had a cumulative incidence of 200 cases per million. And you may have seen that very recently they've released a more granularity of showing exactly where cases are based on local health areas. So for the greater Nanaimo local health area, which has a population of about 120,000, there's been 18 total cases to date, which would give a case per million of 150. So I want to put those numbers into perspective here. So I selected these locations, either countries or states or provinces or regions, just because I feel like there are certain areas that get a lot of attention when it comes to COVID-19. So you have on the left the location. That's not a laser pointer, but I was trying to use it as one. And on the right, the same indicator, so we can use as a comparison, so cases per million. At the top, you can see the USA, about 18,000 cases per million. I won't go through each one, but I'll highlight a couple. So Washington, about 10,000 cases per million, our neighbors to the south. Quebec, Sweden, Toronto, which is actually my old stomping grounds. Before coming here, I was with Toronto Public Health when the first COVID case was detected in Canada. When I left at the end of May, there was 13,000 cases. Then there's Canada, which is about 3,300 cases per million, which is just above the world average at 3,000 per million. BC, comparably, is quite lower at 1,000 cases per million. And when I updated this today, it's close to that, 1,050 cases per million. So while we've seen 300 cases over the weekend, considering that's a population of 5.1 million, the cases per million doesn't rise as fast. Hong Kong, Japan, New Zealand, 3 countries that I feel have really been heralded as success stories when it comes to COVID-19 response. PEI, and then right under that is where we would actually have Vancouver Island. And under that is where we would have the Greater Nanaimo local health area. So all of that is just to say that comparably, the BC especially, Vancouver Island, and even more so the Greater Nanaimo area, has done remarkably well when it comes to keeping the cases of COVID low. And I think that really just speaks towards the response at all levels of government, and including here. I read your COVID-19 recovery plan, and I felt that it did a really good job of carefully reopening, but still reopening certain segments, because we have to make sure, of course, that our actions are commensurate with the risk. Few caveats to this is someone might say that, okay, well, what if we're not just testing enough? What if, okay, the reason that we only have 200 or 175 total cases on Vancouver Island is because we're just missing a lot. And then US has more because they're just testing more. Well, so far we've tested about 50,000 people, so 5,000 more since the 25th of August. And of those, 0.4% have come back positive, which means that 99.6% of people who are tested, and we're only testing people who have symptoms in BC, 99.6% of those people are negative for COVID. So that's one of the key indicators we look at. Comparably in BC, we're at about 2.5% on average, so we're much lower. So we're doing a lot of testing, and if there was more COVID within the community, we would surely be picking it up. We know, of course, there are cases that are not detected, either because they're so mild, or because someone doesn't have symptoms, or because it was early within the pandemic and testing was very restricted. The BC CDC did this study looking at what proportion of people had antibodies and found that there was about 8 people who were infected with COVID for every case that was detected. So if we were to apply that here for Vancouver Island, we could expect that perhaps there was 1,600 cases total so far, which would mean 0.2% of the population has been infected. The last real indicator I want to mention is looking at the amount of community transmission. And what I mean by that is when we have cases that are reported to us where we cannot figure out where they acquired the virus from. Since July, I think now that there's been about 7 cases with possible acquisition on island in the community. So they did not travel during their exposure period. They weren't in contact with someone that they knew had COVID. And so that might reflect COVID being within the environment in the community. And so that is to say that overall, Vancouver Island has a very low rate of COVID-19. Vancouver Island has very little community transmission. And why I think this is so important is because whenever we think about taking off one of those layers, removing one of those restrictions, and the big one coming up is reopening of schools, that it's going to increase the risk of transmission. And however, if you're starting off with a baseline low risk within the community, you're going to be in a very good position to keep that transmission low. And by that I mean, let's say that there was an intervention that you were going to stop physical distancing, and that was going to double the risk of transmission. Well, if you're doubling something and it's already huge, that's going to be twice as big and massive. But as Vancouver Island, where we have a small amount of risk right now, if we're going to double that, it's still going to be small. Thinking of that over, I should have used a different example other than physical distancing, because I want people to keep physical distancing. But it's just to show that I really believe that we are well poised, based on the evidence here, of reopening schools and of continuing to carefully reopen certain segments of society, and to make sure that we have that balance right between the risk of acquiring the virus versus the risk of what our intervention is. This is a map showing the geographic distribution of COVID-19 by health service delivery area. On the BC CDC website, that's where you can find even more granularity now with the local health areas. And really what this shows is that there's been the most of the activity historically and now is within Lower Mainland. 95% of the current active cases are in the Lower Mainland. All right, so that was a pretty rapid update on COVID-19. And I do want to shift gears a bit to talk about the status of overdoses in Nanaimo. And recognizing that this is one of the dual public health emergencies that you all have been working on likely much longer than I have, being new to this area. And also that it's International Overdose Awareness Day, as you mentioned, Mayor. So as you can see by this graph, it goes back to 2010 on the x-axis, and on the y-axis is looking at the number of fatal overdoses, specifically in Nanaimo. That there was a bit of an increase 2010 to 12 to 13, but then things really started skyrocketing 15, 16, and 17. That's when overdoses peaked at nearly 60 for that year, and then decreased in 2018 to 2019. And I think that was through a huge collective effort. For 2020, that, on this graph, this is a projection if we were to continue with the same rates of overdoses that we've been seeing from January to July 2020. So far this year, till the end of July, there's been 24 overdoses in Nanaimo. And if that rate was to continue, it would be higher than 2019 and 2018. I wanted to just add this slide as just a bit of a framework of how just in my mind, how to deal with these really difficult issues that obviously everyone here has been dealing with for some time, with successes, with challenges, and a way of just for me kind of incorporating how I fit into this. So this is the Canadian Drugs and Substances Strategy, and they have these 4 pillars of their framework about how to address substance use. So the first on the left, prevention, is actually preventing people from using substances in the first place. And I really feel that how that's targeted is through the social determinants of health and lifting up people to prevent bad outcomes and prevent disease and prevent substance use is the reason I went into medicine, but I really feel it's the action of the local and provincial and federal governments, and I've seen that already with the action that's being done on supportive housing, with the Health and Housing Task Force, with poverty reduction. I feel like that's where the action is here, and I'm seeing that, and that's how I can perhaps just inform with numbers, with statistics, with literature reviews, with evidence. When it comes to treatment, that's really a lot of Island Health's focus, is those who are already using substances or at risk of using substances, let's say for mental health issues, providing appropriate treatment to them. Harm reduction is meeting people who are using drugs where they're at and providing ways for them to continue to use drugs, but eliminate the risks that exist now from of what you had said, Mayor, with the increasingly toxic drug supply. The last is enforcement. And here it says addressing the illicit drug production, supply, and distribution. I feel that there is a shift among, in politics and among some, including chiefs of police, where it's more of an enforcement against the distribution of the toxic supply of drugs. And the underlying all this is supported by the strong evidence base. And so I feel like that's again where I can come in just to provide consultant role and information. Evidence-based opinions and collaboration. So that's an introduction to me. I really look forward to working with all of you, and thanks for inviting me here today.
Thank you very much. Councillor Armstrong.
Oh, thank you. I do have a question on the 4-pillar approach, because my issue's always been that we're always putting all this time and effort into harm reduction, and the other 2 key pillars to me are prevention and treatment. When are we going to start putting dollars into those? Or do you disagree with that?
So the sound in this room is not great, and I could barely hear.
Oh, sorry.
Sorry about that.
So my question is, I'm not going to look at the enforcement, but of the 3 pillars, we spent all this time, effort, and dollars into harm reduction, very little into treatment, and very little into prevention.
Yeah.
For me, I think all we're doing is keeping people on drug use instead of trying to get them off, and we just keep making the problem worse and worse. As you can look at the numbers keep increasing. So from my perspective, and I know I'm biased in this, is that I see harm reduction as a complete failure. And we're not taking into account neighborhoods when we look at harm reduction and all the issues that happen with them. And if harm reduction was working so well, why are our numbers of addicts increasing so dramatically?
Yeah, I think it's a really good question, and I think looking at this graph, my question would be, what would this graph look like if we haven't implemented the systems that we currently have? What would 2018 look like? What would 2019 look like in terms of overdose deaths? And the BC CDC, they did do a study and showing that with largely the efforts on treatment and harm reduction, that approximately 6,000 deaths had been averted in BC. But I agree that it's not a put all in one bucket. I think it's something that where you need to have focus on all of the areas. I think that harm reduction is a way to really, in the moment of having a crisis, it's essential because people are at immediate risk of dying. But really, we have to look at and using harm reduction as a way to keep people alive so they can be connected to treatment and support. And I think looking further upstream about how to prevent people using substances in the first place is absolutely instrumental as well. And I think that harm reduction is a tool in the toolbox. It's not the be all and end all. And I know that there is more money that's being put into treatment now. I think harm reduction is still getting focused because of the immediacy of the issue, but I think that they all need attention and respect.
Thank you.
Thank you.
Councillor Bonner.
Thank you, Your Worship. Thanks, Mike, for coming out. Appreciate this. In your role, you described your role as monitor and assess health status in our area. And when you do find something that is required or is of a concern, like say our alcohol rates are too high, what is your role to fix that?
Yeah, great question. And so my role is really to collaborate with people and try to move the dial. I don't have any direct reports. I have very little actual power when it comes to things outside of the statutory requirements under the Public Health Act. And so it's really trying to make those connections, try to raise the alarm if it comes up to something that I'm seeing as a health issue, but others are not seen as a health issue. So for example, if that means coming here to present, if it means connecting with community groups who are already acting on this issue and raising their voice, or if it means like taking this back to Island Health as well and saying, okay, we need to reorganize, reorient our services when it comes to this population, for example, because this has been something that's been brought up as a need by the community. Here's the evidence that supports that. So it's not a role where there's like easy fixes that I can do, but it's collaboration that I hope to form and continue.
Now, if I may, Your Worship, I would hope that if there's any way that we can help you with the health of our citizens, I would be more than willing to have you come back here as often as you want. My other question is, how long do you have this role?
It's a permanent role, and I would like to stay in it for as long as they keep me.
Okay.
As long as I pass my probation, but that's up to Richard Stanwyck.
Okay. Thank you.
Councillor Hammonds.
Thank you, Your Worship, and thank you very much for coming. Two questions. One is, there's a growing interest in safe supply and a pilot just down the road in Duncan.
Mm-hmm.
If Nanaimo were to consider also saying that's an initiative we're interested in exploring, could we ask you for research and evidence, et
certainly.
cetera, to help us make our decision?
Yeah, and it would, just on, yes, the quick answer is yes to that I would be involved in that. I know there's already a lot of work that's being done by the mental health and substance use team at Island Health looking at safe supply. That also informed the program that they have in Duncan. One thing I wanted to say about that is, safe supply is not far off from the treatment that is already provided when it comes to opioid use disorder, in the sense that we've been using methadone and Suboxone for years, which is just substituting someone's drug that they're using with something else. Whereas in safe supply is, okay, substituting fentanyl that's being used, where it puts people at high risk of death, with another drug, be it hydromorphone. And so it's something that I feel is often categorized as something that's completely new, that hasn't been tested or studied at all. But to me, it's more so on that continuum already with treatment and harm reduction services that are applied.
Thank you. And one more, if I may. Coming from Toronto, you may not be aware that Vancouver Island has what I would characterize as an unequal distribution of resources, south of the Malahat versus north of the Malahat. What would be your role in supporting us as we advocate for a more equal distribution of resources?
Yeah, certainly. And that's something I was definitely made aware of by every single person I met.
Good.
The Malahat being that dividing line. And how I see it is ensuring that there's equity. I mean, that's a key tenet of public health is not equality, which is quality is treating everyone the same, so having similarity in process, where equity is looking at having similarity in outcomes. So looking at where the areas are that need more investment, that need more resources, that need our attention. And so, I'm connected to the Chief Medical Health Officer, who's now a Vice President with Island Health, connected to the board. And so when there are specific areas where I can propose an evidence-based reason why there would need to be increased resources for something, that's certainly something I can take to my connections.
Okay, thank you.
Councillor Thorpe.
Well, thank you, Your Worship, and through you, Dr. Benuzik, welcome and congratulations on your appointment, and thank you for coming this evening. Director Hemmons asked one of the questions that I wanted to ask about, and I'm very pleased to hear your response regarding advocacy for, to put it bluntly, Nanaimo Regional District Hospital and the needs of this area north of the Malahat. It's something that we hear a lot about, and I think you'll be hearing a lot about.
Yes.
So I appreciate that. My other question goes back to COVID, and we've been hearing and reading a lot about the demands on the testing facilities.
Yes.
For COVID. And as we are heading into the fall flu and cold season, I can foresee a lot of people coming down with what they think are symptoms, maybe just a sore throat due to a cold, and feeling the need to get that checked out. Is Island Health ramping up testing services to deal with that?
Yes, absolutely. And the sustained surge of cases that or calls that we've had to the call center in August is, obviously a bit of a curse because it created a lot more work, but it's a bit of a blessing because it made us really get our ducks in a row before the school year. And so when we look at what we've been doing every day now is looking across what we call the test, trace, isolate pathway to make sure that we have ample capacity throughout that. So from the person who notices they have symptoms and they're calling in, to them being booked at a testing site and being able to be booked within 48 hours. Most people are booked either the same day or the next day right now. To that being sent to the lab and the lab being able to give us a turnaround of less than 24 hours, and I think the average right now is 16, then that being the positives going to the communicable disease team and us being able to rapidly contact the cases, make sure that they're isolating, figure out who their contacts are. And then the next step of that is doing all the contact follow-up. So every day monitoring them to see if they're having symptoms. And so there's been a push, of course, to really ramp up the capacity in the call center. We've been monitoring the rest of it, but right now we haven't had a crunch on the rest of the system because despite the increased calls, we've still been able to get people tested in Nanaimo, usually the same or next day. But we know that in September, we're telling people, if your child has a sniffle, keep them at home, get tested. So we're anticipating more testing, so we're ramping it up even more so than that.
All right, thank you very much.
Thank you.
Councillor Armstrong.
Thank you. I don't know if this falls in your purview or not, but we have a shortage of GPs in
Yeah,
town.
yeah.
Is that something that you can help us with or come up with ideas on how we can advocate to get more? I mean,
Yeah.
especially, I hear that Alberta's not doing so well, so maybe we can draw some from there here.
As an Albertan who's now here on the island permanently, I have some friends I can call over. It's something where it's not like, my role is to try to make those evidence-based opinions that inform, that's a call center again. So this will be my last call, my last question, thank you, is going back to what you're saying, is really connecting the dots to figure out who are the ones pushing for that and make the health argument for that, because it's a pretty easy one to make of why you would need more physicians within an area. And it's something that I'm already, of course, when I've been meeting with my counterparts at NRGH and in the community, the physicians, we're all well aware of. So making sure at the very least that that Island Health is doing the best we can with recruiting, but it's certainly something that I'm going to be more involved in and try to advocate for.
Thank you.
Dr. Music, thank you very much. You've been called twice now. It's good to be popular.
Yes. Okay. Thank you very much. Sorry about the interruptions.
A long life and long career. We'll just take a minute, do a little cleaning, and next welcome our MLA for Nanaimo, Sheila Malcolmson, to speak to BC situation tables and next steps to tackle social disorder. Well, no, she's the MLA for Nanaimo, as opposed to the MLA for Nanaimo North Cowichan, as opposed to the MLA for Parks Qualicum. Good evening and welcome.
Hello, Mr. Mayor, and thank you to the city team that's put a lot of extra measures in place in keeping us all safe. It's a hard time on everybody, and people that clean the podium, this is an extra gift. I want to recognize we're on Nanaimo territory. Thank Mayor and Council for taking time with me tonight. I also want to recognize, as Dr. Banusiak did, that we are also honoring International Overdose Awareness Day, and recognizing, Nanaimo was hit hard and early by the opioid crisis. There are a lot of communities still grieving for lives lost. I'm Sheila Malcolmson. I am honored to be the member of the legislature for Nanaimo, and I am going to talk about social disorder. Is this forward? Yes. The issue probably that I hear the most about as MLA, and I know city councilors do as well. And so I'm not going to talk about social disorder and crime in our community. We know what it is that we are trying to combat, and we know the impact on neighbors, and of course those living hard lives on the street or living with untreated mental health or addictions. I want to present to you tonight a provincially funded tool that seems to me, from what I've learned, could make a difference. It could improve community safety and better connect vulnerable people with services that can prevent crisis and crime and the associated disorder. If you agree, you will invite and convene a deeper conversation. The recommendation is that you would hear that from the Solicitor General's team, and you would invite others that might be part of that table. So this is my 5-minute, very fast download on what I've learned so far. A situation table, hub model, coordinated response, all the same thing, all used sometimes interchangeably by police teams across the country and in British Columbia. It creates a table for problem solving, one case at a time, one person at a time. It is intended to problem solve and break silos between service providers. Better to have police bring a frequent flyer, for lack of a better term, to this problem-solving table where all the relevant agencies can put their heads together, and one agency will say, hands up, I'm the best agency to accommodate and help deliver this person to better services, recognizing that this may be a much better use of police time. And bring the help to that individual that might prevent them from causing problems both to themselves and in the community. I outlined a few more details on this in my August 8 letter to Council. So the three primary partners, the primary partners are government agencies. Island Health, maybe Ministry of Children and Family Development. It could be the school district if the person that is in question may be at risk of suspension. Nonprofits are also included. What's the city role? It would be for you to say that you want it in town, that you think it's a tool that's worth testing. Your bylaw officers may well sit at the table or may refer people to it, but it's not a political role. It's not a download. I come from local government too. I'm sensitive to this question as well. But this tool will not come to Nanaimo if you do not invite it. Situation tables have been established in 10 BC communities. It's been funded in another 4 BC communities. None of them are on Vancouver Island. I'd love to see Nanaimo be the first. In some of those communities, from Burnaby to Kelowna to Chilliwack to Terrace, here is a table that maybe you will study later. It's not beautiful to absorb right now, but the reason that I chose it is I want you to recognize that the list of the factors that cause people to be brought to these tables, whether that was by police or by other agencies, may well resonate with you with what we're seeing on our own streets. In 2020, what was found to drive the behaviors that got folks referred to the situation tables were mental health, drug use, unmet basic needs, housing. poverty would be an underlying factor for sure. This slide shows what happened at BC's 10 situation tables. The primary source of referrals is from police in these 2 years, 2019 and 2020. I hear that the most successful tables are those that are championed by the police chief, and I acknowledge and thank Constable Cam Miller and Acting Detachment Commander Lisa Fletcher for hearing the first presentations and indicating, helping me understand what it might mean for us locally. Files were closed when people that were referred to the situation table got the services that they had up to that point not been able to access. That lowered their risk to themselves and also the risk to their neighbors and community. In 2019, 54% of files that were originally police files got transferred to social service agencies more appropriately suited to deal with their needs. So for this hub model of community support to be established in Nanaimo, the city would need to convene a meeting for the purpose of receiving the same presentation that your CAO, Acting Inspector Fletcher and Island Health reps and I received a month ago. And that Cam Miller and I tried to host on about March 12th, and things in the world changed at that point. So I must admit, I'm feeling that we're racing to make up for lost time. We had some real momentum, and I wish I'd been here presenting to you at the end of March. So that's the first thing, convening the meeting of the stakeholders that you think are the players, both to do with both crime and social services in Nanaimo. And then secondly, you would need to write a letter of support to the Solicitor General saying that Nanaimo is willing to have this tool added to its toolkit in community. This, again, is for your reading at home. I've also got a few printouts on the table, but this is the Ministry of the Solicitor General's one-pager on some of the mechanics of the situation table. If you do agree that you'd like the community to learn more, there's a much more fulsome presentation that breaks out some of these component parts. But I'll say in conclusion, as protest and innovation around the continent is leading people to look at policing in a new way, this is a tool that really does feel like it can get at the heart of the problem. They have emerged in BC as a proven model for community safety. Our government provincially is reviewing the 45-year-old Police Act, partly driven by the need to incorporate what we have learned as a society about mental health and about racism. But we don't need to wait for a legislative change. This is a proven tool that is available for you. Again, I'd love to see Nanaimo be the first community on Vancouver Island to take this on. And I do feel from what I've learned that it could have a profound effect both on those who are suffering in our community, who are committing crime, and absolutely those who are suffering the impacts of social disorder and crime in our community. And with that, Mr. Mayor, I'll turn it back to you for any questions council members have.
Thank you very much, Councillor Armstrong.
And thank you. This existed in the 90s for many years, as well as up until 2013 here in Nanaimo. It was called STAR, and all the players other than nonprofits were at the table. And then without MOUs in place, there was no action. There was also an issue with the fact that people decided they could not share information due to privacy acts, et cetera, et cetera. So what are we going to do to change that? Like I said, this is not new. It's been happening for years and years and years, and it was happening in the community. And like I said, up until 2013, STAR was very active. I sat at the table as well as Constable Wade sat at the table. And exactly what you said was happening, everything other than the nonprofits being at the table. And the biggest issue was, again, there was no resources to send these people to. So we can come up with all the solutions in the world, but without the resources to get them into treatment or to get them to mental health. I mean, right now the waiting list to see a psychologist is 6 to 8 months in Nanaimo. They don't have 6 to 8 months. So how are we going to, it's great to have this, but what are the results going to be?
Yeah. I'm not going to overrepresent my experience with this. Absolutely recognize and respect your experience and your training. This is why I think it's helpful to invite the Solicitor General's team who've been working with this tool. But what I understand from the NGOs, at least on the ground in Nanaimo, that were working with STAR back in the day, is that the lack of power was that the provincial agencies were not there. This is a provincial tool which is being funded and supported by the Solicitor General's ministry as a way to take the pressure off police and to reveal where our gaps are in social services. And the privacy sharing restriction that led to the increased rigidity of silos is specifically addressed by this model.
Thank you.
This
I
is
think, sorry.
and we can have a longer conversation about this, but I think the experience of the regional tables and the places that this spontaneously arose in other communities was specifically addressed by the Blue Ribbon panel of the previous government. Daryl Plekas was the lead on this. This was his design, and because of the failures of these coordinated response tables in other communities, the model's been tweaked. And so I'd love you to be able to have that direct conversation with the ministry staff and have you really kick the tires on this. I'd love to know what you learned.
Oh, as a follow-up, I'm all for this, 100%. I think this is one of the great tools. My concern again, though, is we can come up with all these things, but there's no places to send the people. So I also look at it in ways it can show what our shortcomings are as well, and maybe, put dollars towards that as well. But no, 100% behind it. I think it was great. I've done this my whole career. We were doing these, so I think they're very, very important. And you've addressed what the issues were, which was the silos of the privacy. So that's awesome. Thank you.
Councillor Marmon.
Thank you. And through you, Your Worship, thank you for the presentation, and thank you for anything that's innovative and will help us with the people and our social disorder and elevate the living for all of us in our communities. I have a question. You stated that you've met with the Nanaimo RCMP and Island Health and some of our city staff. It looks to be encouraging. It says 54% in some of the other communities. The experience has been 54% of cases were subsequently transferred from police to more suitable agencies. Is your understanding then is that we're supporting the police, but we're addressing mental health and wellness in our communities in a better way?
So, I think we are experiencing this. Someone phones 911 when someone is disorderly or urinating in public or horrible things. It's the automatic. In this case, my understanding is that then police are able to say, okay, I am now closing my police file because I know that you have caught this person. This is not a criminal act. But in the meantime, we've got police tied up in the emergency room admitting somebody for mental health treatment where... So it is absolutely meant to to get, at the same time, get people to the help that they need without them falling between the cracks. It's conserving resources of all of our social service agencies so that we do not have 5 or 6, or in some cases in other parts of British Columbia that's been documented, 9 different social service agencies all attending to the same person. In this case, one agency basically says, hands up, I've got it, let's move on, and we're going to talk about this person when we meet again in another 2 weeks. I'm going to let you know what's happened.
Perfect.
Or are they still popping up on your screen? Because we are now sharing files and information which but when you as the police officer get the next call, you say, I know it's really social worker Krog that has this file and I'm going to refer you to him. So
That's a frightening thought.
yeah.
Thank you. Thank you. I'm excited about what could be a very positive outcome. I'm hopeful.
Yeah, well, what we're doing right now isn't working. It's burning people out. Very brave people, especially in the NGO community, that have been holding the ball for a long time. Our government is trying to build up all the social service resources, but we are starting at a deficit. And every community is in competition for the same kind of resources that we need here. So I'm encouraged about the ability to try something different. And as Councillor Armstrong says, it may well reveal in a more documented way on the ground where our gaps are. We know there are gaps. It may help us fill them faster and more strategically.
Councillor Gesselbrook.
Thank you, Your Worship. Thank you, Ms. Malcolmson. I think that, yeah, these are, I think, will be a really useful tool, and hopefully that we can move forward in securing something like this in Nanaimo. My question, just sort of building on Councillor Armstrong, was in the situation tables that have been happening elsewhere in the province, have they helped identify where there are some gaps in the services and resources that are available, where there's bottlenecks and people are continually just sort of cycling, you know, in a circuit in the community, and there's nowhere for them to go? Have any gaps been identified thus far through these?
Again, I think that's a detailed question that I encourage you to ask of the Solicitor General's staff. I'm presuming that you do want to hear from them, but my understanding from the conversations that I have had is that this coordinated response gets better outcomes no matter what, even if it means that you're only dealing with a smaller handful of truly intractable problems. At least your agencies are not duplicating service by all of them chasing down the one person. And at least we are making our best effort, if this is not a criminal matter, but a mental health matter, of having the mental health professionals focus on that person. This is not a silver bullet, but it sounds to me as if it's better than the system that we've got right now. And given that our resources are unfortunately scarce, while we still build up and train more young professionals that want to enter the field and give some support and reinforcement to the very brave and committed NGOs that have been carrying the ball on their own for a long time, that we're going to do better than we have in the past and better than we're doing right now today. Working together in a better structure and working more efficiently for better outcomes for people.
Great. Thank you.
Councillor Hemmons.
Thank you, Your Worship. I'm in support of getting more information, and I have a motion to that effect, and I'm looking for your guidance on whether now or during business arising would be more appropriate.
Am I sensing a general sense that people would like the ministry staff?
Thank you. So then I will move, and I'll share this with staff, that the City of Nanaimo organize a meeting for Solicitor General Ministry staff to present the situation table model to Nanaimo-based agencies and nonprofits that might form Nanaimo's situation table, and that a letter of general support be provided for the concept of establishing a situation table in Nanaimo and any associated grant opportunities.
Any discussion? Councillor Armstrong.
I don't know if it's appropriate, but I know I see Inspector Fletcher here, if that's something that the police would be engaged in, if it's possible.
I think. Mr. Rudolph.
Opportunity to speak as well. And just to encourage Acting Superintendent Fletcher to be able to speak just for a moment, if you were interested to hear it. Firstly, I want to thank MLA Malcolmson for bringing this to our attention. This is a provincial program that she's simply alerting us to. So we did do a little bit of homework on this in advance of this, thinking that you might want to get a little additional information. So from the RCMP point of view, I think Ms. Fletcher's able to comment on that slightly before going forward, but the idea would be if there's an appetite to bring in folks for a more detailed session, that's easy to do. What I think you're going to hear is that the preliminary assessment is that it's a tool, it's been successful in its refresh of this new version of things, and it's something that will not hurt us, it will only help us.
Please. We have to do a little quick cleanup, though, first. Good evening and welcome.
Thank you,
You've
Your
been
Worship
very
and Council.
patient.
Councillor Armstrong, may I have you repeat your original question so I can make sure I hit it right?
I just wanted to know, sorry, it's very loud. I just wanted to hear your take on if it was something that would fit really well with the way the direction the detachment's moving and if you have the resources to do it.
I think, based on the preliminary research that I've done into it, I've talked with some of the detachments that have done it. I very much am supportive of it. The rationale that drives that decision for me is detachments that have done it speak of the fact that once the file involving a person who has been kind of a frequent flyer gets referred to the appropriate resource, the incidence of them re-citizenizing, I practiced that word, but I screwed it up.
Recidivism.
The recidivism of the individual is dramatically reduced. So from the police perspective, why wouldn't we? I mean, we're going to actually dramatically reduce those calls because we're dealing with it more effectively. You know, we get the call frequently as a police agency, but we are often not the right one. It's just we work 24/7 and we have a really convenient phone number where we can where we can connect people into the right agency. And I think it's a very, I'm kind of excited for the first time a little bit about the fact that this is one tool. I'm hearing of other tools in the community and other work that's been done by people here at the table, and I'm seeing it all kind of align, and what we've been doing presently hasn't been meeting the needs, so I'm quite excited to do it, and I'm supportive of it, and it lines in nicely with some of the other initiatives that we're working on.
Thank you.
And before I go to Councillor Bonner, I can't resist also adding you get the call and then you get criticized for not performing a standard of perfection that shouldn't be expected of any people in your situation having to deal with very difficult circumstances, and that's the very reason you get called in the first place, is because other people don't or can't deal with the situation. So I just want to show some respect for the hard work of your members in this community in particular. Councillor Bonner.
Thank you, Your Worship. No questions for Inspector Fletcher, but I do want to say I'm in support of this motion. I'm seeing from the work that we're doing at the Health and Housing Task Force, I'm seeing the work that BC Housing is doing in our community. I'm seeing the changes that are taking place at Island Health, and now this, and our navigation center we're going to be talking about later. I think it's quite clear that provincial government has recognized that all the citizens in BC are having this problem, and they're actually making sure that the tools are available to actually make a difference. So thank you for everyone for that. So I'm definitely in support of this.
Thank you very much. Thank you, MLA Malcolmson. I'm not seeing any further speakers on the list. Mr. Rudolph, unless you have anything further to add? All those in favor? Any contrary? None. Motion carries. Thank you very much. I think it's a good step in the right direction. The next item on the agenda, committee minutes. They're simply to be received. We have no consent items. We have no delegations. And under reports, the first is Development Variance Permit Application number DVP 404-905 Hecate Street. Mr. Lindsay, good evening.
Thank you, Your Worship. Before I start, I'll just say normally at this point when I'm introducing my reports, I turn it over to our director, Jeremy Holm, to walk you through the reports, but because of the measures we have here for COVID, I'll do my best to introduce the reports, and Mr. Holm's available this evening. If there's any very specific questions that I need to call him up for, we will do that. As you mentioned, the first item on the agenda this evening is for a development variance permit, and I'm not going to go over in great detail, Your Worship, because I notice you have a delegation from the applicant, but I would note the development variance permit is for two items, and there is a site plan on attachment D in your package this evening. Attachment D shows the proposed location of the addition to the building, which will accommodate an expanded daycare, and that will require a front yard setback reduction from 6 meters to 4.2 meters. And again, it's only for, as outlined in the site plan here, it's only for a portion of the building of the addition. The second is to reduce the minimum required parking on the site from 14 to 0.
Now, in fact, and historically, parking has been accommodated on the adjacent property, and through this process, the applicant's proposing to formalize that with a lease with the Island Corridor Foundation, and as such, staff are supporting a reduction in on-site parking as there is adjacent parking that has been secured. Thank you, Your Worship. Certainly happy to answer any specific questions.
Thank you very much. There's a delegation, Councillor Brown. I thought you were dressed up for a heavy date tonight. Maybe that'll explain your. Mr. Freeman. Oh, Ms. Freeman, pardon me.
Thank you so much for having me here today.
Good evening.
I wanted to come just to personally answer any questions that you may have. I know a few of you know about our daycare. We are a small, not-for-profit daycare. There aren't very many not-for-profit daycares in Nanaimo, and we're proud to be one of them. We serve just over 40 families with 20 children attending daily in our 3 to 5 program and 12 in our infant toddler program. So we really have grounded ourselves within the community that we're located, which is on Hecate Street, just downtown. And this would be a great addition to our building, providing more services to our families. As you all know, there's quite a need for daycares in this town, and I personally turn away 3 to 5 families a day. It's a lot. So this would provide us more opportunity to give more spaces. Additionally, we were very fortunate to receive funding from the government to do this addition. So we have a lot of support from the government in our vision of expanding. We've also previously received funding for a prior project, so they approved this project within less than a month because of the success that we had with fulfilling the prior requirements for a different project. Yeah, so I just really wanted to be here to personally answer any questions about this. And say.
Thank you very much. Much appreciated. Councillor Bonner.
Thank you, Your Worship. A question, if I may, a couple actually. Right now, I drove by the place today, and I noticed the area where the parking lot is scheduled to be. Does it get used? It looks like there's an awful lot of trees in there.
No, so it's owned by the Island Corridor Foundation, and it has been left to overgrow. We are just a block away from another area that had an overgrown, I guess, vegetation that had become quite a problem recently, and we've seen a bit of overflow from that. So this would benefit us greatly to be able to have a clearing so that we could maintain a safe space close to the daycare so that people aren't using drugs or sleeping or other things.
Okay. And then may I ask, since that's not being used as a parking lot now, how do you manage your parking and dropping off of kids and picking them up and that sort of thing?
Right now it's street parking, but with increasing our classroom capacity by 14 more families, we will need more parking. Also, we have been allowed to have, I guess it must have been grandfathered in when we first set up the daycare, so there was no parking requirement when we first established. But now we're increasing our parking capacity, not just for the new addition, but for the whole building. And so that 14 spaces would help with the flow of traffic. It is a dead-end road, but between 8 and 9 in the morning, it's pretty chock-a-block of parents dropping off kids. So this would alleviate that congestion. Also because our staff would be parking there, so then the parents would have better access to that street parking so that they'd be able to drop off easier.
Mm-hmm. That's actually, as goes, a great question, because now I'm not going to do what I was thinking of doing later, which is probably good for everyone. My other question, though, is out beside there there's a sidewalk running the length of your property there, one of the few in the area. And does that typically get used as a drop-off zone? And would you be interested in having it designated as that, or is it just fine as it is?
Absolutely, I'd love to have that designated as a drop-off zone. or a portion of that area. But that was another process that I would have had to have gone through, and I'm working on this one first. But yes, absolutely, I'd like that, at least in the immediate area in front of our building, to be designated for drop-off.
Okay, thank you.
Councillor Bonner, I think you're suggesting a job for staff. Councillor Armstrong.
Thank you. I just wanted to thank you for finding alternative ways so that we're not impacting the neighborhood traffic or parking area. So this is something that I know goes against my grain, but I will be supporting. Thank you.
Thank you.
And Councillor Thorpe.
Oh, thank you, Your Worship. Through you, thank you, Ms. Freeman, for attending this evening. I'm inclined to be supportive, but I'll admit, and I'm surprised at Councillor Armstrong, I have some concerns over the parking issue. Given that you couldn't secure a covenant with the Island Corridor Foundation, and I've known that covenants sometimes get changed or disregarded. And it says in the staff report that this is going to be dependent on a lease agreement with ICF. So my concern is, what if ICF, and we don't know what they're going to be doing in the coming years, what if they decide that they don't wish to continue or proceed with this lease agreement? And then it says that if that is the case, the applicant will be required to provide parking on site. So that begs the question, is there room for parking on site?
We do have room for parking on site. Our belief is that we want the kids to be outside as much as possible. And so the parking would substantially take up a large area of our play space, which right now especially, we want the kids to be outside even more so than normal, because having them inside is, of course, with COVID, a bit more of a risk. And so we could put the parking on our lot. It would alter the outdoor area. I don't know, I haven't done the calculations if we'd still meet the minimum requirement that VHA requires us per child of outdoor play space, but I could do that calculation. But I think, it's a fairly large play space, so we might, I know that we could fulfill the parking requirement on there, but like I said, I don't know exactly if we'd still then meet the outdoor requirement.
All right, thank you. I certainly agree with you that play space for children is more important, but I would just like to feel assured that worst case scenario, you could handle it.
We could do it, and Island Corridor Foundation has agreed to do a 10-year lease with us with renewal. They said that they would renew with us, and it's a strange triangular piece of land that is really quite narrow, and obviously, they couldn't give me a full 100% assurance that they weren't going to develop it, but they said that it's pretty, I guess it's pretty minimal chance that they would, because of the size of it and the proximity to the rail line.
All right, that reassures me. Thank you.
Thank you.
Mr. Lindsay, you're standing and hovering. Is there anything you wish to add to Ms. Freeman's presentation? It's a broad hint that I think council will take. Ms. Freeman, thank you very much for your presentation. Is there anyone who would care to move the recommended motion? Councillor Brown, seconded Councillor Armstrong. Any discussion? All those in favor? Oh, sorry, pardon me. Yes, it pops up as Guri.
Yeah, thank you, Your Worship. I just had a question actually of staff when I'm looking at the aerial photograph on attachment F. Farquhar Street comes down to the railway tracks and then appears to stop there. Is that the actual, Mr. Lindsay can, so it doesn't carry through to Hecate Street, I'm assuming, the right of way?
No, that goes, so it stops the end there on the right side of the train tracks, sorry. And our lot is,
yeah, I understand that. I can see that, but my concern is the right of way for Farquhar Street extending through the property. Thank you.
I hope not. Thank you.
Very good. Councillor Brown?
Thank you. Thank you, Your Worship. I'm not sure if I'm on. Thank you, Your Worship. I'm very happy to support this, and just a note that I think in my 2 years on council, we've spent more time talking about parking spaces than we have the important spaces of childcare. So I just like to put that in perspective.
Thank you very much. You and I are of a similar mind. I was tempted to cheekily interject. I'm sure we could see the picket signs now. Kids, not cars. All those in favor? Opposed? Motion carries. Thank you very much.
Thank you very much.
The triumph of the children over the automobile tonight. Well done. The next is Mr. Lindsay, once again, Covenant Amendment Application Number CA12-497 Menzies Ridge Drive.
Thank you, Your Worship. As you mentioned, this is for an amendment to an existing covenant. And I would note, as outlined in the report, the covenant itself was registered as part of the overall development of these lands back in 2011. And at that time, limited the maximum density on this portion of the development to 16 units. Since that time, 6 units have been developed in this area, leaving under the covenant 10 remaining. In this case, the applicant's proposing an amendment to the covenant to allow for an increase from 10 to 22 units. There is a conceptual site plan on attachment, I believe it's attachment C, and an air photo on attachment D, and I know that you also have a delegation from the applicant this evening who's prepared to give you a brief presentation and answer any questions.
Thank you very much. Any questions for Mr. Lindsay? We do have the delegation here. Steve Johnston. Come down, introduce yourself, give us your address, and away we go.
Good evening, Your Worship and Council. I'd like to acknowledge that we're on Nanaimo territory. My name is Steve Johnson, and I live at 2067 Forest Drive. I'm the managing partner for proposed development at 497 Menzies Ridge Drive here in Nanaimo. I'm here today to go over the proposal to amend the existing covenant from 10 homes on site to 22 homes. Sorry, Mr. Thorpe, another covenant amendment. I wanted to start off by saying that amending any covenant is a tough situation. Decisions were made by previous council and staff for certain reasons, and to go back and amend them is not something that is taken lightly. I believe, Mr. Thorpe, you would have been the only one on council when this covenant was applied. That being said, the city of Nanaimo has gone through unprecedented growth since this covenant was issued. Part of this issue is, as Your Worship said, in a previous covenant amendment application for 6340 McRobb. Our city has too much geography and not enough densification. I agree with this wholeheartedly and believe that we are moving in the right direction to address this. Our project at 497 Menzies Ridge Drive is a much simpler project than 6340 McRobb. We are simply trying to do a project that lines up with what the property is zoned for, which is R6 townhome zoning. That being said, here are the numbers. Under the R6 townhome zoning, we are allowed the following. A floor area ratio of 0.45 plus an additional Tier 1 density bonus of 0.1 and another Tier 2 density bonus of 0.15. Total of 0.70 floor area ratio if we achieved Tier 1 and Tier 2. We are proposing right now that we're going to stay at 0.45. However, we're planning on achieving the Tier 1 and hopefully the Tier 2 guidelines so we have a better project. Our lot coverage on the property, we're allowed 40% and we're proposed at 23%. Not only with our project having no variances, we will be increasing the DCCs by approximately $142,000 and the community amendment contribution by $12,000 for a total of $154,000. In addition, the extra 12 homes generating yearly tax revenue for the city of Nanaimo. The plans, let's just go to the next slide here. The plans, although they aren't finalized, we're planning on building a higher end townhome complex. Hardy board, hardy panel, longboard, quartz countertops will be some of the highlights, as well as substantial landscaping with irrigation to complement the budding Buttertubs Marsh. We feel that by doing a higher-end project, we will not only increase the value for us, but we will also complement the neighborhood. There are some concerns with this project, and I'd like to address these based on our neighborhood public consultation on May 27th. I believe everybody got an email or 2 or 5 or 10 in regards to this. Unfortunately, this was not a good meeting, as it was the first consultation held via the Zoom platform in the new COVID-19 era. It seems to me that people behind their computers are a lot more aggressive.
Hardly.
I know it's a surprise. Regardless, here are the main concerns that I heard and how we've addressed them since that meeting. Number one, originally we had 26 units, 26 homes on the property. What we've done is eliminated 4 units to a total of 22 in total, so we could increase the green space on the property itself. Number two, I've worked with Caleb Horn, the planner for the city, as well as city staff, as well as the engineering and public works departments at the city to address the traffic concerns that the neighbors had. We actually proposed traffic calming through our CAC. However, all departments said that this is not required due to the low traffic count in the neighborhood. As you can see, there are 4, better get to the next one. Sorry, there's no pointer here, so I can't show you the roads, but I'm going to point out Menzies Ridge Drive, Sarum Drive, and then Poets Trail, and then Bird Sanctuary Drive, and then as well Stonewater Drive that is not complete, but will be extended all the way to Wakasaya, hopefully in the next few years, depending on the developer for that site. There's lots of egress and a lot of access to the site itself where we're planning our development. And the disperse of traffic for this property is more than suffice according to city officials. The last concern was the access point off Bird Sanctuary. And this is a close-up of the access point. It's pretty tight. This lot was developed a long time ago with intentions of this being a road, always has been. There was as Mr. Lindsay had stated, there were 4 units, those 4 right in front, and then there were 2 on the other side on Menzies Ridge that were duplex lots. The city approved the duplex lot of 225 and 227 Poets Trail Drive, knowing that there was going to be access points coming in here to the site for Menzies Ridge Drive.
I just need to interrupt for 1 second. Ms. Robertson, refresh my memory. Do we have to limit him to 5 minutes?
Oh, 1 minute away. It is 5 minutes that I was told. I stretched out a little bit.
So what was the question you were hoping Councillor Bonner would ask you that would illuminate you?
Me? Yep.
Councillor Bonner, you're on the list.
I am?
Yes. You don't have to be.
I'm not on the list.
Councillor Armstrong.
Just my concern, and obviously I'll be putting it through to public hearing, is the increased traffic and the access, so that will be something. And my other big concern is when people buy these homes, they look at the covenants. And when we keep changing them, it's really hard when people do their due diligence. So those are concerns that I take into account pretty seriously, because a covenant is much different than a zoning change. It's actually a legal document which we keep breaking all the time, and it's, you know, it's frustrating for some of these people when they, you know, buy based on a covenant, and then all of a sudden we change it. So those will be concerns I have, but I'll wait to hear what I hear from the public. Thank you.
Thank you.
Councillor Turley.
Thank you, Worship. I'm not sure if this is a question for staff or if Mr. Johnson can answer it. I'll ask the one that I think he can answer first, and that is is there an entrance from this property onto Poets Trail?
To where, sorry?
Poets Trail?
Towards Poets Trail?
Poet Trail, yeah.
No, it's, there's two access points, one on Poets Trail right as you see.
Yes.
And then on Menzies Ridge. I don't know if we have a close-up of
Well,
Menzies
yeah,
Ridge.
Menzies Ridge, I understand.
That's right.
It was Poets Trail, I was asking whether
Yeah.
there's an access there or not.
Just from that previous, oops. That's Poets Trail Bird Sanctuary. It changes from Bird Sanctuary to Poets Trail Drive, and that's where that second access is.
So that is an access.
Yeah.
Okay, thank you.
And just so I'm clear on the concept, in fact, there will be less coverage of the land in terms of building footprint,
Correct.
a more substantive green space around the project, but increased densification. Obviously, we're going from 10 to 22 units potentially for Nanaimo families.
Correct.
Thank you.
The biggest concern that, you know, for access points and emergency vehicles, fire truck safety, I was on volunteer fire with City in Nanaimo. One of my biggest concerns with this was this access point, and as well the circulation for emergency vehicles, which of course Ms. Armstrong is in tune to. We already went through that process to make sure that the circulation was okayed by all emergency services, including the fire truck access with the bigger truck, just so we made sure that that was front and center. That was just a little more personal for myself.
Anyone else? No further questions to the delegation. Thank you very much, Mr. Johnson.
Thank you very much, everyone.
Councillor Armstrong, you're moving the recommendation? Is there a seconder? Councillor Bonner? Councillor Turley?
Yes, Your Worship, I have a question of staff. Oh, there he is.
Mr. Lindsay anticipates everything.
I know, he's incredible, isn't he?
He even gets good insider knowledge on who's buying what in town.
My question through you, Your Worship, to Mr. Lindsay is currently the access to butter tubs from Menzies Ridge has bollards restricting the type of traffic that can go through, so I'm assuming that that's not a dedicated road.
Maybe I can ask if the air photo, Derek, if we can bring the air photo up on the attachment, just so I make sure. So Menzies Ridge to Butter Tubs, so just that you can see Menzies Ridge ends there in the cul-de-sac, sorry, through your worship. The intention at the time of the subdivision was not to allow that connection through ultimately to Bowen Road, but to make sure that it was available as emergency access and also as a pedestrian priority to make that connection through there. So at this point, the bollards are in place and vehicle access is restricted, and there's no plans to remove that or to allow for vehicle access.
Councillor Thorpe.
Thank you, Your Worship. I just wanted to make a brief comment so Mr. Johnson wouldn't be disappointed. I appreciate his being here tonight, and I'm happy to support moving this forward to a public hearing, at which point I will keep an open mind, of course, but at this point I have no objections to the project. I can say that safely, I think. But I do want to state for the record that I have, in principle, a concern whenever we alter covenants. And this is another case of a development which was approved on certain conditions, very formal conditions in the form of a covenant that covered the density. And now, what is it, 9 years later, we're suddenly changing the rules and saying, oh, well, we'll allow greater density and forget about the formal agreement that we made that approved this development in the first place. So it's a general concern for me. I feel that we're degrading the whole meaning of putting a covenant on something by continually revisiting them and devaluing them. So, as I say, I will support moving this forward to a public hearing. I have no specific objection to the proposal, but I think in principle I need to make that statement. Thank you.
Well said, Councillor Thorpe. Thank you. Councillor Hemmens.
Thank you, Your Worship. My comments actually follow along Councillor Thorpe's. The reason the covenant was registered, it's written in the report, is because of the perceived development demand. Can you explain that to me, please?
Yeah, Your Worship, I'm not sure that sentence captures it accurately. I think what staff were trying to say there is that the covenant at the time secured what was understood by the developer of that time as being a response to the market. So that their proposal came forward with that number of units in that form and that density, believing that that's what the market was requiring at the time in 2011. As you've heard, 9 years on, I believe there's additional pressures for additional density. And I think that's what staff were trying to say in that line about why the covenant was proposed.
Okay, thank you.
Councillor Bonner.
Thank you, Worship, and I certainly appreciate Councillor Thorpe's comments regarding covenants. I look forward to the future as we go through our OCP amendments. We can avoid these covenants by just getting rid of the concept of single-family zoning and just go with multiple family zoning throughout the city, so then we wouldn't have these problems. Thank you. Just throwing that out there.
I was going to say, why not just attract a few stones? Any further discussion? All those in favor? Opposed? Motion carries. Thank you very much. The next is housing agreement number HA 2-326 Wakesai Avenue. Mr. Lindsay.
Thank you, Worship.
Student housing.
Thank you, Worship. And as you mentioned, this project is for student housing, and under our zoning bylaw, there's a requirement when you have student housing on a site that you secure it through a housing agreement. The legislation requires that housing agreements are adopted by bylaw, so we're here this evening asking for Council's consideration of the first three readings of the associated bylaw. In this case, the agreement, if ultimately adopted by Council, will limit the development to 165 beds of student housing. The units must be for students, and also the agreement requires that it include a resident on-site manager in the building. Your Worship, I'm certainly happy to answer any questions that Council may have.
Councillor Turley.
Thank you, Worship. To you and Mr. Lindsay. I'm just trying to figure out what the definition of student housing is, and I see this here, but I don't see any mention of food services or kitchens. Are they included in the units, or is there a central kitchen that provides?
Through your Worship, to Councillor Turley, there is no requirement in our bylaw that there be additional food services or cafeterias in these. They're simply residents. But because of the nature of the type of resident, there is different regulations around. For example, parking is one where we have reduced parking areas, especially around the university, but no requirement for additional services on site. No.
Thank you.
There's no further questions. Would someone care to make the motion? Councillor Brown, seconded Councillor Hemmens. Any discussion on this? All those in favor? Opposed? Motion carries. Thank you very much. The next is housing agreement number HA 3-20 Barsby Avenue. Again, Mr. Lindsay.
Thank you, Worship. And again, in a housing agreement requiring three readings of the associated bylaw. In this case, the housing agreement is required as a result of density bonusing. So under your zoning bylaw, there is a schedule that allows additional density on sites subject to achieving certain targets. In this case, the applicants have successfully incorporated public art, garden space for tenants.
Your worship, I'm sorry to interrupt, Mr. Lindsay. Point of order, if I may. Am I missing something, or on the last item, do we not have bylaws to read?
Oh, you're absolutely right. The mayor is asleep at the switch. Thank you, Councillor Thorpe. I think we need to reverse course. The motion should be that it pass first reading. That's the motion made by Councillor Brown, seconded Councillor Hemmens. All those in favor? Councillor Brown? Pass second reading. Seconded. Councillor Bonner? Any discussion? All those in favor? Motion carries. Councillor Brown?
I'll move the third one.
Pass third reading. Seconded. Councillor Armstrong? All those in favor? Opposed? Motion carries. And finally, a motion that council directs staff to register a covenant to reinforce the terms of the housing agreement. Moved Councillor Brown, seconded Councillor Hemmens. All those in favor? Thank you very much.
Your worship.
Yes. Now we're on to housing agreement number HA 3-20 Barsby Avenue. Mr. Lindsay.
Thank you, Your Worship, and thank you, Councillor Thorpe. I was moving too quickly trying to get to the next item. As I mentioned, this is also a housing agreement. In this case, although it's not for student housing, in fact, this is for seniors rental. And under the bylaw, you have a provision for density bonusing. In this case, the applicant has incorporated public art, garden space for tenants, car share parking, and a green roof, in addition to securing that there should be no restriction on rental. And the housing agreement specifically will make sure that in the future there's no restriction on the rental of these units. And again, Your Worship, we're recommending Council proceed with the first three readings of the bylaw and direct staff to proceed with the registering a covenant.
Councillor Armstrong.
Move recommendation 1.
That it passed first reading.
Oh, pass first reading, sorry. I'm used to the RDN where we don't have to read them all out.
Does it have to be actually read out, Ms. Robertson, or can we?
It would be helpful to read the bylaw out.
Okay. Recommendation 1, housing agreement bylaw 2020 number 7314 to authorize a housing agreement to prevent any future restrictions on the rental of individual units at 20 Barsby Avenue, pass first reading.
Seconded Councillor Thorpe. All those in favor? Opposed? Motion carries. Councillor Armstrong.
Housing agreement bylaw 2020 number 7314, pass second reading.
Seconded Councillor Thorpe. Any discussion? Councillor Hemmens.
Councillor Turley.
Thank you. A question of staff through you. So we can implement rental-only zoning, I understand. That's a new power given to us by the province. Why would we go this route to ensure that people are going to be able to rent these units rather than a rental-only zoning?
I think, Your Worship, I think this is a good larger discussion, but my quick response would be that this allows for the market to respond and has flexibility in your zoning so that if appropriate, applicants can come forward with strict market housing, or there's greater flexibility and opportunities to encourage different types of housing, including rental through density bonusing. So I think both are tools that are available to council, and in our case, we've at least to date decided to allow the market to respond and make sure our zoning bylaw has flexibility within it.
Thank you.
Councillor Turley.
Thank you, Your Worship. Through you to Mr. Lindsay. I just wanted a definition of what is meant by future restrictions on the rental of individual dwelling units. Does that mean that if an individual owned it or purchased it, an individual suite, that they couldn't sell it as a condo, or what's the reference there, or is it the rate of rental?
Your Worship, what this housing agreement would do if adopted would prevent a strata or a corporation in the future from bringing in anything into their bylaw that would prohibit an owner from renting their unit. So the units, there's no restriction that could be put on by a strata corporation, for example, that would restrict an owner from using their unit as they see fit. to use it, to live in, or to rent it.
Thank you.
Councillor Bonner?
Thank you. I also had a bit of a problem with it. I guess understanding it is in part of the, under the no restrictions on rentals, I think 2.3, it talks about unless an agreement is amended to exercise, I think that's what it's saying is, how do we know for sure that the owner, the developer, is going to be able to restrict the strata with their vote if they, and how are we going to guarantee they're going to have the majority vote, or am I misunderstanding this completely?
Your worship, I think council could think of this much like, I don't want to say, but much like a covenant.
It's the C word.
Where you're binding, in this case, you're using a legal instrument to bind the strata council from doing such a thing in the future. So they would not be able to adopt a bylaw that said no rental, or rental of these units is not permitted. It's telling them that it's not something under their purview. So forevermore, anyone who buys a unit in here will not have to worry about, or who owns a unit here would not have to worry about a strata council coming in at some future date and deciding that rental was not permitted. Sorry, does that answer your question?
It'll be untitled, registered. Anyone who buys knows, and if the strata council attempts to say you can't rent or fine you, covenant's enforceable against the strata
So
council.
we could have the entire property being owned by people from some other place, not living there, but renting it out?
Yep.
Yes.
Yeah, okay.
Yep.
Councillor Armstrong?
I'll be opposing because I think it's wrong to force stratas to have to rent. Having lived in one and saw what happened when bad renters come in, and it really diminishes the value of the people's homes, so I'm opposed to it, so I'll be voting against. Thank you.
Councillor Hemmons?
Thank you. Just a question on that front. This is not imposing that owners rent. This is just saying, if you want to rent, we're not going to restrict you to do that, or we're not going to say you can't do that. Figure that one out.
I'm trying to find, yeah, sir. Yeah, it's, your worship, at the end of the day, it's ensuring multiple flexibility for an owner of a unit. It allows them to, in a typical case, if it was a strata, it would allow them to own that unit and live in it, or it would guarantee that forevermore, they could also rent that unit out. And that a strata in the future, with a majority vote, could not change the bylaws to prohibit that rental. It protects their right for rental of that unit forever.
And just to be clear, Mr. Lindsay, this allows greater densification on this site with further units that wouldn't otherwise be allowed.
You're correct. That's absolutely correct, Your Worship. And it's entrenched in our zoning bylaw as one of the things we've been trying to achieve and incentivize is as a tool to protect rental. Again, not requiring it through zoning, but saying if there's a tool to protect it, we'll consider additional zoning on your site.
I appreciate Councillor Armstrong's concerns, but I think in the circumstances, it's allowing greater density is what we are generally hoping to achieve. Councillor Turley?
So further to Councillor Armstrong's question, if, God forbid, one of these places got rented out and there were bad tenants, we'll say, dealing illegal substances, shall we say, is there an opportunity then to apply the nuisance bylaw, or is that prohibited as well?
No, the nuisance bylaw would apply regardless, and moreover, the strata rules regarding behavior of tenants in the building would govern as well.
Okay.
It's not going to reduce any restrictions or prohibitions that would exist now, am I correct?
That's correct, Your Worship.
We've been talking so long, we're just at second reading.
That's correct.
All those in favor? Contrary? Councillor Armstrong?
And recommendation that housing agreement bylaw 2020 number 7314 pass third reading.
Seconded.
Seconded, Councillor Thorpe. All those in favor? Opposed? Motion carries.
No, opposed.
Sorry, Councillor Armstrong's opposed. Forgive me.
And the council directs staff to register a covenant to reinforce the terms of the housing agreement.
Seconded.
Seconded, Councillor Thorpe. All those in favor? Any opposed? Councillor Armstrong? Thank you very much. Item E, rezoning application number RA 454-5485 and 5495 Godfrey Road. Mr. Lindsay.
Thank you, Your Worship. As you mentioned, two subject properties on Godfrey Road. There's two properties currently with two single-family homes. There is a site plan on, maybe I can ask that we pull up attachment C, which shows the conceptual site plan with the two lots consolidated and the two single-family homes removed. The conceptual site plan is showing 10 units on the site. And we're here this evening seeking council's direction on first and second reading prior to forwarding this item to the public hearing. There's also a recommendation that for a covenant to secure consolidated access and to secure the community contribution prior to adoption of the bylaw.
Any questions for Mr. Lindsay? Councillor Martman.
Do you know if the design of the development and the community consultation, whether or not there is improvement to the roundabout and limit it to one driveway access?
Your Worship, I can confirm that the development will be limited to one access, and it will be generally in the location that's shown on the plan here in attachment C, which will be as far away from the roundabout so as not to interfere with that. Ultimately, when these projects are done, your frontage works and services bylaw requires upgrades to city standards, which can require curb gutter, sidewalk, repaving to the center line of the road. I'm sorry, I don't know in detail what that would mean for the roundabout. Obviously, it would be difficult to improve 1/4 of the roundabout, but I'm sure there's improvements overall proposed along the frontage.
For pedestrian safety, et cetera.
Yes, and if that's a concern of council, I'm sure we can provide further information on that at the public hearing.
Thank you.
Councillor Armstrong.
My recommendation is zoning amendment bylaw 2020 number 4500.181 to rezone 5485 and 549 Godfrey Road from single dwelling residential R1 to low density residential R6 past first reading.
Seconded, Councillor Thorpe. All those in favor? Any opposed? None. Motion carries. Councillor Armstrong.
Zoning amendment bylaw 2020 number 4500.181 past second reading and.
Seconded, Councillor Thorpe. Any discussion? All those in favor? Opposed? Motion carries.
And council directs staff to secure the road dedication section 219 covenant with condition of one driveway access and a lot consolidation and a community contribution prior to the adoption of the bylaw. Should council support the bylaw at third reading?
Seconded, Councillor Thorpe. All those in favor?
Question for me.
Question. Sorry, Councillor Bonner.
Since this seems to be the night of covenants, to me, this covenant doesn't really need to be done, because if they're going to build the driveway, it's not like they're going to rip it up next week and build two driveways. Wouldn't that be covered under their application building permits?
So your Worship, that's a good question. The concern right now is there's two separate titles. So technically, two titles are allowed for two access points. So what we want to do is make sure that if this proceeds to rezoning, that ultimately the lots are consolidated and that it's clear that you're only going to get one access. You're not going to have one access from each titled property. So I think it is, I agree with you, it might be somewhat overkill, but I think to make it clear for any potential future purchaser, I think I would advise council to proceed.
Okay.
Very good. All those in favor? Opposed? Motion carries. Thank you very much. The next is proposed bylaw amendments to subdivision control bylaw 1989, number 3260, Schedule A, the Manual of Engineering Standards and Specifications. Mr. Rosen, good evening. Nice to see you.
Good evening, Your Worship, Council. Yeah, the next item is the bylaw readings for the update to the Manual of Engineering Standards and Specifications. As Council is aware, this process has been ongoing for more than a year and a half. There's been an enormous amount of consultation with the public, with the engineering community, development community, so on and so forth. It's probably the biggest update to the engineering standards in more than a decade. And assuming council passes this, it's going to result in some extremely innovative and very up-to-date road standards, for example, that will ensure complete streets are the standard that gets produced in new development and in city capital works. So I'd be happy to answer any questions if council has any.
I don't see any. Let me just say, before I ask Councillor Armstrong to move the appropriate motion, that council is grateful to the, I would suggest probably Herculean efforts of you and other staff, Mr. Sims' department generally, to ensure that this matter, which was complex to say the least and did raise significant concerns in the development community, has been resolved to the point where I suspect tonight it will pass unopposed and we don't have anyone here opposing it. And that, as you've indicated, it will assist in making this an even better city in terms of the things that will be developed as a result of this and the manner in which they'll be developed. So thank you. Councillor Armstrong.
Recommendation that subdivision control amendment bylaw 2020 number 3260.05 to amend Schedule A Manual of Engineering Standards and Specifications pass first reading.
Seconded, Councillor Thorpe. All those in favor? Oh, sorry, Councillor Brown.
Thank you, Worship. I think these are a little bit understated. These are very significant upgrades, and I would just like to thank you and your team for putting them together and all the feedback. And I think the award that was won for these is very well deserved. And please give, I think, my thanks and probably the rest of council's thanks to all those that worked on it.
Hear, hear. All those in favor? Opposed? Motion carries. Thank you very much. Councillor Armstrong.
That subdivision control amendment bylaw 2020 number 3260.05 pass third reading. Or second reading, sorry.
Seconded, Councillor Thorpe. Any discussion? All those in favor? Opposed? Motion carries. Thank you very much. Councillor Armstrong.
That subdivision control amendment bylaw 2020 number 3260.05 pass third reading.
Seconded, Councillor Thorpe. All those in favor?
Finish the questions at second reading.
Opposed? Motion carries. Thank you very much. The next is the BC Housing Navigation Centre. Mr. Lindsay.
Thank you, Your Worship. As outlined in the report this evening, we're seeking council's direction with respect to a potential opportunity for a navigation center. And just to back up a little bit, we heard earlier this month from the province through BC Housing that they were intending to open a navigation center in Vancouver. And in that announcement on August 5th, they also made reference to a second facility on Vancouver Island without identifying the exact location, simply on Vancouver Island. Your Worship, we've put this report together to give you a little bit of background on what we know navigation centers to be. I think it's fair to say that they're still, these are relatively new, certainly to Canada and BC, and staff have pulled together the information that we have on these facilities and how we understand them to operate. I would describe it generally as a hybrid between shelter and purpose-built supportive housing, in that unlike shelter beds where people line up each evening with the hopes of getting an accommodation, people would actually be assigned to a navigation center. So they know already that they have opportunity to have a warm, safe place to stay, but also are surrounded by health supports, which ultimately help them. The intent is to move to the next step in the housing continuum. Your Worship, you'll notice that there is not a recommendation here from staff, and we are simply bringing this forward for council's consideration, but there are a couple of options that we've outlined in the report. And the first is, the first option that council may wish to consider is authorizing the mayor to proceed with a letter of support to the Ministry of Municipal Affairs and Housing regarding the city's interest in hosting this navigation center. I would note in the option, there is a reference to, for people experiencing homelessness, an agreement, with Island Health provide an adequate level of integrated clinical health supports. And I think that's one of the details, Your Worship, that I think from staff's perspective, that's necessary in any housing project, that there is that collaboration and integration of supports and a full true wraparound supports for people. The second option we put in the report, Your Worship, is that As council's well aware, the Health and Housing Task Force are currently going through their work, and council may wish to consider referring this item to the Health and Housing Task Force for their consideration. And the third option, Your Worship, is not to proceed with any further action at this time. Certainly happy to take any questions.
Thank you, Mr. Lindsay. Councillor Bonner.
Thank you, Worship. To start the ball rolling, I'd like to move option that council authorize the mayor to provide a letter of support to the Ministry of Municipal Affairs and Housing regarding the City of Nanaimo's interest in hosting a navigation center in Nanaimo for people who are experiencing homelessness that involves an agreement with Island Health to provide an adequate level of integrated clinical health supports.
Councillor Hemmons has already seconded it. Almost before you'd finished, do you wish to speak to it first?
Yeah, I think, as I mentioned earlier, there are a number of things happening in our society where solutions are coming forward, and this is another one. The difference between this and a shelter is the component that is the integrated clinical health supports. And I'm quite convinced that BC Housing and Island Health want to see these things successful. And I'm looking forward to the future conversation we'd have with them regarding possibility of having one here in Nanaimo. Thank you.
Thank you, Councillor Bonner. Councillor Armstrong.
I'm opposed to this for a couple of reasons, and I'll go over them. Number one, having done a lot of research on them, there's a lot that say that they don't work. Success rate is less than 14%. The cost to run them in the States is over $4 million, so I don't know how we can run them for 1.5, and that's also including the lease of the building. So I struggle with that. I struggle with the fact that, based on information received, that these are going to be drug and alcohol allowed in that. When you do the research, San Francisco, Fremont, Portland, Seattle, and Minneapolis, were just the 5 I looked at, all say the success of theirs, when the partial success is based on the fact that there is no alcohol or drug use on site. So my concern is we're going to see the exact same thing that's happened around these others, is that we're going to have dealers in the neighborhoods. And I don't support the use of alcohol and drugs on site. If that was removed, I would support it. However, I think it's just going to bring more problems to the community. We have all these individuals that are on Wesley Street, which we all know about, that wouldn't even qualify for those based on the criteria. They're homeless, they don't want to be housed. So I don't know how that's going to solve our problem. And my final point is that we don't even have housing to put them into. So we're going to have all these people come, but where do they go? We don't have the housing, we don't have the supports. So for those reasons, I'll be opposed. Thank you.
Thank you. Councillor Turley.
Thank you, Your Worship. This question is probably directed at Councillor Hammond and Councillor Bonner. Has the Health and Housing Task Force had an opportunity to discuss this type of a scenario, or is this something new to you?
Councillor Hemmons.
Your Worship, through you to Councillor Turley. The Health and Housing Task Force hasn't had an opportunity to discuss this concept specifically. It's just come so quickly, but I can tell you that the work that we're doing is in alignment with something like this. It's not all of it, but it's certainly a piece of it.
Councillor Thorpe.
Thank you, Your Worship. Through you, I feel unfortunately I can't support this at this time. I share many of the concerns of Councillor Armstrong, but I think for me the main consideration is that although this seems to be a little bit more, I'll use the term upscale, it's basically another supportive housing project. Certainly different from a shelter, but not a lot different from the other supportive housing projects that I see the city proceeding with some controversy. Also, which we have been told will have wraparound supports and a mandate of trying to wean people away from the supportive housing that they are in need of at the moment. I look at the staff report under neighborhood impact, and I note that the operator and a location would need to be selected. And more importantly, and I'm quoting, a challenge will be finding a suitable building and location to host a navigation center in Nanaimo. When selecting the location, it will be important to consider impact on the neighborhood, with attention paid to crime prevention, public disorder, as well as the delivery of other social and recreational services, end quote. I feel, quite honestly, that we are doing a lot with the Health and Housing Task Force and working with BC Housing and the provincial government. I'm sensing that our city is sort of at supportive housing fatigue right now. We've got enough challenges facing us to get the proposed buildings up and running and satisfying the concerns of the neighborhoods where they will be located. I don't feel I can support taking on another similar type of project at this time, so I will not be supporting it. Thank you.
Councillor Martman.
Thank you. I will be supporting the motion. And first of all, we don't even know that we would actually get the navigation center. It is being proposed that we are one of the cities that might have the opportunity to receive this service on Vancouver Island. So I think at least we should be exploring what is the opportunities that can come our way. But this is about housing those people that are the hardest to house. These are the people that can't even survive in a shelter. So they need additional supports. They need to be somewhere where there's 24/7 because there'll be washrooms, there'll be some place to sleep. And this is my idea, but I'm just throwing this out there. I do believe that our residents have been hit hard, as we all know. And the BC Housing we will have in South Nanaimo, we can do this. I know we can. I'm a South Nanaimo person, and we have a proud community that knows how to work with people. But perhaps we could look at some of our industrial areas, because this is 24/7 support. So these people don't need to necessarily go out in the streets. But I think of some of the people that I see every day pushing the shopping carts, not cohesive, have major, major problems. And this may be one step towards that solution, to which we get countless emails and phone calls from people who are afraid and tired of our city. And if this helps to house 60 more people that we can take out of the doorways and give them the support that they need, if that's a measurement that works towards success, I want to at least say to the province, Nanaimo is open and we're ready to help and work with you to make improvements to our society. Thank you.
Councillor Kesselbrock.
Thank you, Your Worship. There's this opportunity for the province to invest $1.5 million of resources, medical resources and housing for individuals that are currently wandering on our streets without support and medical support. And this resource is also to provide support in terms of helping them identify and move them into more suitable housing, whether it be supportive, addiction detox, along whatever spectrum of need, and have the people there to identify it. This is exactly what we are in need of. There are issues, of course, that down the production line, we do have a lack of secondary housing. We do have a lack of addictions rehabilitation. But that does not mean that we stop implementing the infrastructure and institutions that we need to tackle this issue. I have to remind that we have 600 homeless people. The last count was 425 homeless people on the streets, and we do not have accurate data identifying the degree of mental health issues, substance abuse. This is a site that the province will be taking responsibility for, that will be giving us much in-depth and better data on this so that we can build out our infrastructure further as we move forward. So I believe that would be a great loss of opportunity not pursuing this, and I strongly support this and strongly ask other councillors to do so as well. Thank you.
Councillor Brown.
Thank you, Your Worship. I too am very strongly in support of this. I do note it is a pilot project, and obviously there will be data gathering and to see how effective the program is. Will it work, or will it work to a level that I think we're satisfied with, or we'll see the provincial government roll it out further. I have no idea. But what I do know is what is currently happening is not working. Well, we are missing a lot of, and I'm looking forward to the sort of the gap analysis, but it's clear we're missing a lot of supports. I'm not going to ever try to oppose something that is a piece of what we need. 5% is better than 0% effectiveness, and I'm hopeful that we will get it, and I know it will be a challenge to cite it, but I think our community is in great need, and we can't always say that we want resources, and then if they come to us, say, actually, we don't want those ones.
Councillor Bonner.
Thank you, Worship. And I hear what Councillor Thorpe and Councillor Armstrong are saying. Whenever these things come up, I look at, okay, what happens if we don't have it here? That means the situation that we're in right now continues on. So this is another tool, and this I honestly think will fit in quite nicely with the situation tables. This is the type of place that people would be referred to who end up in those tables. So I just look at it as not so much we're having supportive housing fatigue. I think we're having homelessness fatigue, and our empathy in our city is waning. And that's because we have people who are homeless and we don't know where they are and we don't know what they're doing. So this will give us an opportunity to put 60 more people into a place where they can at least get some sort of services and get back, hopefully, into some sort of better housing. Well, it's going to work for all of them? Probably not, as Councillor Brown has said. But it's one of these things. We're going to try it. If it doesn't work, then we should be trying something else, because just doing nothing and just letting them stay on the streets is not working. Thank you.
Councillor Churley.
Thank you, Your Worship. So I just want to confirm that the motion is to have yourself write a letter to the Minister of Municipal Affairs and Housing expressing an interest in hosting. It's not saying we're going to host. So there will be other opportunities to say yes or no in the future before this thing comes to fruition or not, correct?
Absolutely, Councillor
Thank you.
Churley. Councillor Hemmons.
Thank you, Your Worship. I'm in support of the motion, and I just want to outline my rationale for that and address a couple of things. First of all, I think when we're looking at research, we need to look at Canadian research. I think context is so important. This idea that we're missing a lot of supports, I actually don't know that we know that. I think the Health and Housing Task Force is allowing us to see that we might actually have too much of one support in one area. It's actually distribution of supports that we need help with. The work coming out of Dr. Turner's work at the Health and Housing Task Force is showing us that coordination is where we could do better. This is an opportunity funded provincially to look at doing better coordination. So just so I'm really clear in my thinking, I do have concerns about this, and that those concerns are around funding. 3-year pilot projects, it's great to get this influx of cash, but if it works for some and not for others, and somehow the funding falls through, what does that look like for the community? So that's something I'm thinking about. I am thinking about citing this and where in the community this could go. I'm thinking about health supports, because we know that for everything that they're doing, VHA's mental health and substance use program is completely run flat out. So if we're now looking for them to adapt and do something different in a navigation center, that's going to be essential to the success of this. So I'm thinking about that. I'm also thinking about the continuum of housing referenced by Councillors Thorpe and Armstrong. We can build 1,000,001 supportive housing units, but if we don't have somewhere to move those folks along to and create that continuum, then we're failing. But the reasons I'm for this are that this is a $4.5 million investment by the province into 2 cities. And I think for all of the challenges that we know we're facing, we would not be wise to turn down funding looking specifically at this issue, because we know in Nanaimo we have a huge issue. The citing, I know, is going to come back to us, because again, this is just a letter asking, to say we're interested, we need more information. So it's not a done deal. I also want to be clear that this is a piece of what will be, I think, a bigger suite of solutions to this issue, and that this isn't This is just one part of it, and we can't apply a frame of thinking that we can solve homelessness by bringing in these resources. We have to be really realistic. But ultimately, I think where I'm at is that the Health and Housing Task Force has been working for the last year and a half, establishing relationships that would help something like this succeed. So I think we've been waiting for something like this to test how our relationships are going and our new way of doing business, et cetera, et cetera. So I choose to be hopeful with this, but I do have reservations. But I think for $4.5 million of investment from the province, specifically at an issue we know we have, it would be silly of us not to write a letter. Thank you.
Councillor Armstrong?
I guess one of my questions is that if BC Housing and Health and all these are doing such a great job, why do our numbers keep going up and really going up year after year? So we've had supportive housing here since 2012, and with 68 million put in by the Liberal government, not just a few million, with supports. Now that there's been a change and they've changed their criteria, the numbers of crimes are going up, the numbers of issues at these homes are going up. And we still have a huge, huge increase. Every year we keep more and more. So if this is actually working, we should be having a decrease, not an increase. So that's one of my concerns. My other big concern is right now, the hardest of the hardest to house will not qualify for most of those areas. They're not gonna work there. We're gonna still have our issues on Wesley Street. And if you look at the research, and there is no Canadian research, that's why we have to rely on US research, which this government is relying on. That's how they chose navigation centers, was on the research coming out of the States. So that's a concern I have, just as you said, but there is no Canadian research on it. And we're not doing anything to tackle the problem, which is the criminal element. And I don't think people are scared of homelessness. I think they're tired of the criminal element that are part of the homelessness. I think people would love to support homeless that are there for legitimate reasons, those that can't afford an apartment or whatever, and we're doing absolutely zero to support them. So that's a huge issue for me. Why aren't we putting some of our supports into those that want to help themselves? We're not doing that. We're putting all of our supports into people that don't want to help themselves. The other issue I have is that when people do want to help themselves, those that go to detox or whatever, when they come back, they're put right back into supportive housing, where it's almost, I think the failure rate coming back from detox to those is 90-some%. We need the second stage housing, which nobody's talking about. So I'm really concerned about it. I'm concerned about the impact. I mean, I don't think there's going to be properties other than in the south end that are going to be able to accommodate this, because the costs are going to be astronomical in the north end. As for industrial areas, we have very limited industrial zoning right now. So I would hate to take that away when we don't have enough. So that's another concern. So there's just too many unknowns for me, and I think right now we've got our hands full trying to deal with the 4 without adding another group, which just means more and more homeless will continue to come here because they know they're being supported. Thank you.
Councillor Brown.
Thank you, Your Worship. I think there's a lot that happens in our community that doesn't come to the council table. A lot of homes are being built both by the public sector and the private sector that are whether it's rent supplements or BC Housing funded projects or other sources of funding to provide affordable housing for those that may not have addictions. I don't know. We don't know. There's a lot of addictions that happen in regular households. So I think we often focus on supportive housing, and I think it's easy to say that's our emphasis, but the reality is that it is our emphasis because it often requires rezonings. And so it hits this council table where there's a lot of affordable housing built for a lot of people, and whether it's affordable enough, that's a greater question. That just never hits this council table. And I also think we need to be very careful when we say that building these services increases the problem. I think our medical health officer sort of highlighted that there's a flip side to that question, and it's how big would the problem be if we weren't trying to tackle it at all. So I think it gets very hard to divorce the thread sometimes between what is the problem, what is the solution, and what's working and what's not working. And we just need to be careful as we navigate that world.
Councillor Martman.
Thank you. I just needed to respond. Although we do talk about supportive housing a lot, and BC Housing is building the 3 supportive housing, we are also building rent to income. It's going in Cranberry, it's going on Fifth. We do have apartment buildings that will be rent to income. So we're not just focused on supportive housing. We're trying to focus on making this a livable community for everyone to be able to afford it. Thank you.
Councillor Thorpe.
Thank you, Your Worship. I'll briefly speak a second time to this, and I'll start by saying that I do understand and appreciate the comments of my fellow councillors, even though they'll be voting differently than I will be. And I really hesitate to turn down money from the province related to a problem that we have been expressing frustration over. And I also recognize that we're simply at this point writing a letter. But my understanding is writing this letter will have a fair amount of weight down the road. And down the road, I'm not convinced that I can support this project. And I'm really trying to wean myself away from using the term a homelessness problem, because I think we have done a lot, and the province has done a lot, to address the problem of affordable housing and various levels of that. What we have is a problem of people with mental illness and or drug addictions. And I don't believe we're supposed to use that term anymore, but that's the term I am familiar with, so I will use it. So if this money was to be spent on a treatment center to address those problems of mental illness and drug addictions, I would be in full support. I don't think this money, even assuming that we got it and could find a place to site this facility, would address the root problem that we're really faced with, which is not people who can't afford a home. We can help those people. There are options for them. The people that we are struggling to help are the people that have addiction and mental health issues. And this does not address that, and it just, in fact, perpetuates the problem. So it's not where I think the focus should be, and for that reason, I won't support it.
Councillor Martman.
Thank you. And I'm hoping, and I agree with you, Councillor Thorpe, what I would like to do is show the province that Nanaimo is open, willing, and wanting to work with them. And after we get the navigation center, we'd like a treatment center for about 150. So we can work on this in steps. Thank you.
Firstly, let me compliment every member of council who's spoken to this issue tonight. It is the topic of our town. It is the topic of our times. Notwithstanding COVID, not a lot of people writing to me about COVID. They're a bit frustrated in our community, but what they write about, if it's not the mural, which seems to have passed mercifully off our email commentary and absorbed more time than I can ever imagine, this is what people talk about. I am incredibly sympathetic to the frustration that Councillor Armstrong has expressed tonight around what the issues are, and Councillor Thorpe very well articulated what it is. It has become the tiresome language of our time to talk about homelessness. The reality is people without mental health and addiction issues have slipped in and out of homelessness often in their lives, all related to poverty and circumstances, divorce, whatever. What is keeping the core and most disturbing element of people who fill our streets are those who are suffering from mental health and addiction issues. Notwithstanding the wise words of Councillor Gesselbrock many months ago, who said, "Stop talking about institutions, Mr. Mayor, talk about therapeutic communities," or the words I've used before from Doug Backhouse, my friend, talk about full care residential health facilities. I remain convinced as we treat an 85-year-old with Alzheimer's, that we have them in a safe, secure environment, that they can't leave voluntarily and can't leave. The same kind of compassion that compels us to do that, that allows us to accept that as a society, is surely the same compassion and common sense, I might add, that should allow us to deal with those severe cases who are in the streets, talking to themselves, dirty, homeless, obviously unhappy, often unfed, ignored, picked up repeatedly by police, taken to the hospital, discharged in a day or two, and sent back out in the streets quite literally to wait for the next overdose or the next death or the next bit of misery they cause for themselves or others. So I feel the frustration of Councillor Armstrong, and expressed, I think, by all of you inferentially around this table. It is utterly beyond belief, and I'll try and shut up in a minute, utterly beyond belief that in the 21st century we should be having this discussion over and over again as they are around council tables all around this province and across this country. It is an appalling mark on this nation when other countries have stepped up to the plate and dealt with these issues in a way that's appropriate. And if it's a legal issue around human rights, then get on with it, Mr. Federal Government or Mr. Provincial Government. But in the meantime, in our cities and on our streets and in our neighborhoods, people are suffering. What kind of a world is it where the City of Victoria is now putting up posters, telling people to check the parks to make sure there aren't needles when they take their kids to play there, providing staff to ensure that needles are picked up, the needles of which are provided again by the good taxpayers of the people to ensure that people who use drugs don't end up with infectious diseases and create a greater burden on the healthcare system or indeed injure their health more as they end up in hospital. And at the same time, we don't pay for needles for diabetics. Now, that's one gut political reaction that I feel from people when I talk to them. They're saying, when is it my turn? When are you going to respect the fact that I've played by the rules and you're asking me to help those the most vulnerable in our society, but you're not really respecting me as a taxpayer? When is it that why is it that people get to publicly use drugs in our community? Why is it that people get to urinate or defecate in the public? Why is it that people get to threaten others and not be stopped by the police? Why is all this happening? And I feel that frustration, and I suspect anyone who's listening to me can feel that frustration tonight. But what we're being asked to do tonight is simply this. The option one drafted by by staff, to whom I give full credit for the wonderful wording of this, and I say that quite sincerely. The wonderful wording of it is, we are being asked to provide a letter of support on the presumption that the provincial government will indeed provide the funding for a navigation centre, which, if properly run, the worst case scenario as I see it, depending on location, which will be decided a long ways down the road, may in fact lead to a detriment to the neighborhood in which it's located, and we'll face that problem if and when it comes. But in the meantime, what we're being asked is to be allowed to be the possible recipient of these funds in order to hopefully improve the lives of people whose lives of misery I cannot imagine. I'm going home to a warm bed tonight and a wife who loves me. Imagine all of the people in this community, in this province, tonight who are sleeping somewhere in parks, in our own parks, etc. All we're being asked to do is fund a navigation, is to ask for a letter of support to see if we can enter into an agreement with Island Health that they'll step up to the plate and provide the health supports. We know what BC Housing's mandate is. It's to provide housing. And you know what? With great respect, as Councillor Martin will point out, they're doing a heck of a job in our community. We should be grateful. There are literally hundreds of units underway. We got 159 units for seniors nearly ready at Buttertubs. We've got the new low rental units for seniors down at the end of Mill Street. Marvelous. I mean, lots of good things are happening. But we're not addressing the hard to house, the difficult cases. And all we're being asked to do tonight is support the option of sending a letter and doing it. I'm sympathetic to what Councillor Thorpe has had to say, and I'm very pleased that he's reminded us all again that this is a mental health and addictions issue. This is not a homelessness issue per se. Having said that, you know, I'm not the best gardener in the world, and sometimes in the spring when something shoots up, I've pulled it out and realized later it wasn't a weed, it was actually a flower. Well, I guess I just want to say tonight at the end of this, I don't know whether this thing will be a weed or a flower, but it's a little early in the process to make that determination. So I will support giving this thing a chance till we get to the next level, till we can decide if in fact Island Health is ready to step up to the plate in a meaningful way. Because if they won't, quite frankly, I'll be voting with Councillors Armstrong and Councillors Thorpe. If this thing is just another, no offense, small part of a very large solution that will really not advance us whatsoever, then I'm not going to do it. For me, it's like a bridge. On one side, you've got bad health. On the other side, you've got good health. And the only way you're going to get over to good health is if there's a good solid bridge there that has no gaps. Doesn't matter how good the pillars are or the supports, if there's big gaps, you'll never get to the other side. If this is part of what the province finally steps up and should be doing, and what the federal government needs to contribute to and think about, is a real bridge that gets us from good health, from poor health or bad health to good health, I'm saying give it a little bit of a chance. We're not there yet, but I'm not prepared tonight to turn down the opportunity to move us a little further down this road and see if this works. But I want to emphasize again, as Councillor Hemmons has expressed her concerns around this, and she's worked in the healthcare field and understands this as well as anybody, and lives in a neighborhood that has worked hard to improve itself and seen the devastation that comes from people suffering from addiction and mental health issues, I say give it a chance. I'm sorry I went so long, but it's been a month since I've had a chance to open my big mouth, so I guess that's maybe an excuse. Anything further? All those in favor? Contrary? Councillors Armstrong and Thorpe. Thank you very much. Now, properly speaking, we should have had an adjournment at 9 o'clock. Do we wish to continue, or do we wish to take a short break? I'm seeing some interest in keeping going, and we'll take a 2-minute break and a 2-minute break.
Your Worship, Mr. Harding was very excited about getting up here.
Sorry?
Mr. Harding was excited about getting up here. He has a new sports coat tonight. He was.
Hi, Leonard Krogh here. I'm here with Karen Lindsay today. She's going to show me how to sign up for our app.
Voyant Alert, the City of Nanaimo's emergency notification system. So we'll start by going into the App Store, Mayor Krogh.
Done.
Next, you're going to hit search. And you're going to search for the app, which is Voyant Alert. So it's V-O-Y-E-N-T. Now you see, it's already selected it. Click there. Hit get, and then we're going to install.
And why are we downloading this app?
We're downloading that so that you can get this onto your phone system, and what it will do is it will send you a push notification out. So if the City of Nanaimo issues an emergency alert, it will actually push the notification out onto your phone. The really nice part of this app is that it's anonymous, so it goes by postal code. So we're not requesting you to put your name or personal information in. It just works off of the app through your phone system. There are also, if you have family members or friends that maybe don't have a smartphone or would like another way, you can also sign up online or call our Public Works Department, and they have phone and texting options available as well. So there's lots of options for people depending on what their needs are.
Fabulous. So you can rest with some comfort knowing you can find out what's necessary and know that people who are important to you are notified.
Absolutely. So now you have Voyant Alert on your phone. And now just select open. So the next thing you're going to do is you're going to tap in the postal code that it's prompting you.
All right. So
you just click on there and start entering. And then find on a map. So here you'll see the welcome page for the City of Nanaimo, and you want to subscribe to notifications, yes?
Yes.
Click that you agree to the terms, so click both to the yes for consent, and then hit next. And it's going to ask to either allow or not allow notifications, and you want to always allow.
Always allow.
Always allow. And the reason that is, if you don't allow, it won't push the notification out to you. So always allow.
Always allow.
And now you see here, you've got a message to accept that you've signed out. That's the two-factor authentication, and you're going to tap yes. And now you're in the system. Also, when you have a moment, we recommend that you pick your locations and sign up based on those locations, and then you'll get alerts from the City of Nanaimo.
Karen, thank you. Everyone, sign up.
This is the 2018 redux of the lighting at Nanaimo's historic bastion. I've had the pleasure of being part of the relighting project on this amazing building in downtown Nanaimo. So what we did is we've replaced the original high-pressure sodium lights, which basically did an okay job of lighting up the bottom 10 feet of the building, and replaced them with modern LED lighting that has the capacity to change color. We can run through a number of different colors that we have pre-programmed here, in a pink, a purple, a green. Probably my favorite on here is Rainbow Chase for Pride Week. It'll actually run all the way around the building all the time.
With this new technology, organizations can now request that the bastion be lit to promote their cause by going to the City Nanaimo website and following the instructions. Go to Your Government.
Order, everyone. The next item is H, Investigating in Canada Infrastructure Program. It was to be introduced by Ms. Legan, but we have Ms. Fulla tonight. Good evening.
The city has an opportunity to submit an application under the Investing in Canada Infrastructure Program. So tonight we're here for council to select a project and provide the resolution that is required with the grant application. Ms. Walker is going to give you a bit of background about the program, and then Mr. Harding is going to present to you the three different projects that staff have shortlisted for your consideration.
Thank you very much, and thank you for your patience, all of you. Good evening,
Mayor and Council. Tonight I would like to provide you with some information on the three projects that staff has shortlisted for consideration for the funding opportunity available under the second intake of the Community, Culture and Recreation funding stream. You may recall that the City of Nanaimo applied for the first intake of this program with the Port Theatre project. This funding stream focuses on projects that improve access to and quality of culture, recreation, and community spaces. The federal and provincial governments have committed up to $100.6 million towards intake number 2. The combined maximum contribution per project is up to 73.33%. Stacking rules do apply, so projects that currently qualify for the gas tax fund would not qualify under this. Municipalities may submit one application. The funding stream is designed to focus on to target projects that start in 2021 and 2022, and the project must be completed within 5 years of approval. And the application deadline is October 1st, 2020. Shortlisted applications in the first intake requested an average grant of $2.5 million. So projects most likely to receive funds provide value for money, are in proportion to the size of the community, and consider the equitable distribution of funding. The three projects that staff have shortlisted for council consideration are the artificial turf field at Harewood Centennial Park, the Loudon Boathouse, and Maffeo Sutton Playground Phase 2. And I'll turn it over to Mr. Harding for details on the shortlisted projects.
Thank you very much. And a special thank you to Mr. Harding, who's coming off his holiday.
Yes, just taking a pause on my holiday.
And who looks very nice tonight.
Thank you. New tie also. It's tough to keep. It's tough to keep up with the Lindsays of the world, so you got to keep doing something. So, Your Worship, as Ms. Walker mentioned, we've got three projects here, and again, the ones that are kind of in the works are, and we've mentioned before, Council knows about them, and they're kind of scalable, so different sizes of what we can do, because Ms. Walker may mention afterwards is what the annual, maybe she mentioned it, what the annual actual award of the last grant was, which was, I think it was around 2 million? 2.5 million. So even though it looks like it's a big pot of money out there, the actual average was around 2 million in that. So one of the first ones was the artificial turf fields at Centennial Park, and we mentioned this during our stadium report. So we'll show some pictures in a second, but it's 2 synthetic fields. It would also include lighting, covered players and officials benches, areas for spectators seating, secure off-field storage area, perimeter walkway, very similar to the NDSS Community Field or the Merle Logan second artificial turf fields at Bevan Park. This is just an initial concept. We would refine it over the month. Again, as Ms. Walker mentioned, we only have a few weeks to get a good application in, and in that time we'll fine-tune some of the concepts. This is a little bit of a 3D version of it. There's also really not 100% finish off the Harewood Centennial Park Improvement Plan, but definitely be the last of the major projects to go on to the overall work that's been done for that park over the years. And of course, this the skateboard park opening a few weeks ago. One of the benefits here again is a lot of community use, but also we work with an agreement similar to the NDSS Community Field with the school district on school board use of the field, particularly Barsby Sports. So right now, the estimated with this concept is estimated 4.47 million. The grant application would be that we'd be looking for, if council picked this one, was to go for 3.28 million. City share would be 1.9 million, funded from Strategic Infrastructure Reserve, and we'd also look for continuing with some partners within that time. It's not included in the 2020 financial plan, so we'd have to put it in. If selected, we'll add to 2022 for construction. Benefits completes the current park, provides all needs of the community and adjacent school, increases the inventory of all weather fields, which would get us to 5 artificial turf fields, which would provide a lot of use. The second one is, again, council knows well, as you've provided funding to do the detailed design this year, is the new boathouse facility at Loudon Park. You had the funding in for this year, which we're just about through the design. Again, this is a partnership with the 2 rowing clubs, the paddling and rowing clubs, and of course the Rotary, which was looking to this as a 50th year service celebration. And of course, we're replacing the Centennial project well before it was City Nanaimo parkland, washrooms and change rooms. Oh, there we go. So here's the initial draft. The council hasn't seen this yet. We'll be bringing it for you later as the process goes through, but this is the design of the boathouse now. This gives the general area, if you know where the washrooms are now and the lake are now to the left, and the general floor aspect of it, of what the facility would look like. So estimated construction is at 1.87 million, so a grant application here would be 1.37 million. City's share would be 0.5, and of course other private contributions then would offset the city's contribution. Again, if this is selected and we were awarded, construction would start in 2022. Again, some of the aspects, of course, would create, which we've talked to council before about, a modern boathouse facility, provide year-round washroom change rooms for the public, a dry program space for recreation, primarily for the clubs, improve security, safety, and accessibility, enhanced year-round programming for all ages and abilities, and meets the objectives of the Loudon Park Improvement Plan. Again, we're picking projects that are already approved. Other one would be building possibly the successful phase 1 of the new playground at Maffeo, and again scaled down again a little bit in price. This would be phase 2 of phase 3 of the redevelopment of the playground for the inclusive play. And so we've just, like mentioned, opened up the inclusive play for 5 to 12-year-olds in June. This phase, if we go for this grant, would be inclusive play for 2 to 5-year-olds. And the further phase down the road would be a water zone. So again, just adding on, as I think all council was there, we kind of pointed out where the addition would be for phase 2. So in addition to traditional play elements, the inclusive part of it, with musical and audible play, sensory panels, quiet play spaces, plantings, things that will service all children with different abilities. And a few more shots of it. So financial details, estimated construction, $663,000. Grant application would be $486,000. City share, $177K, funded by Strategic Infrastructure Reserve. And again, we put that in the plan if we're successful in the 2022 to be built that year. And the last slide, I'm going to, this includes just some aspects again about inclusive play. Again, the meaningfulness of it and the environment for all ages and abilities. As this slide here shows, lots of different, really trying to make it accessible for everybody. And the last slide, I'm going to turn back to Ms. Walker.
So tonight, Your Worship and Council, we are asking for a council resolution or direction from the council as to which project you would like us to proceed with and permission to go ahead and apply for the grant. You may be aware that in August of 2020, the early part of August, the federal government announced a COVID-19 resiliency stream funding. At this point, that fund is still in process. I spoke with the ministry today. They're still a couple of months out as to the details of what that funding eligibility will look like. But I am pursuing it, and we will stay on top of it and approach you again once we have more information.
Thank you very much. In order, Councillors Armstrong, Turley, Thorpe, and Bonner.
Just a question. I notice these are all from recreation, but we do have to replace the windows at the Port Theatre. Is there any reason why that wasn't taken into consideration, or does it not qualify? Yeah, but it's a lot.
It does qualify, and again, there's a variety of projects we could put in front of you. The culture, that's around $700,000 to replace the windows. So the grant would be similar to the playground when you're looking for, I believe, about $600,000, $500,000 grant you'd be looking for.
Okay, thank you.
Councillor Turley.
Thank you, Your Worship. Is it appropriate at this time to make a motion?
Maybe just let us go through the
Okay.
list of speakers first, and then I'll come back to you for... Do you want to say something now?
Not
Apart
yet.
from the motion?
Not yet.
Not yet. Holding your powder. Councillor Thorpe.
Thank you, Your Worship. I guess following along the lines of Councillor Armstrong's question a moment ago, I think I just heard Ms. Walker refer to the first intake and the Port Theatre expansion grant. Am I correct? Did I hear that, or did I mishear that?
I think, yeah.
Just a yes or no is good?
Yes.
Thank you. So my question then is, because what council was told, I believe at the time, was that grant was actually looked upon quite favorably, but they were just oversubscribed. So was there a reason that project was not considered to be resubmitted?
I think, Your Worship, through the Council of Thorpe, again, when the average contribution is around $2 million, that grant, I think, was $15 million we'd be looking for on that one. Yeah, so it'd just be, again, just the scale of it.
Through Your Worship, to Councillor Thorpe, that grant application that we submitted in intake number 1, it was more than the largest grant they gave out in intake number 1. So yes, council could submit it again for intake number 2. Staff has tried to bring you projects that we think potentially would have a greater chance at success based on the information we received from the ministry, that 2.5 million was the average on intake number 1. And every time we phone them and asking for information on this grant application and also the COVID stream, they continually remind us to scale our request.
Thank you very much.
So that's what staff is trying to do.
And that certainly makes sense. Thank you.
Councillor Bonner.
Thank you, Your Worship, and through you to staff, May. There's 3 applications in front of us. I'm looking at the grant details and project eligibility, and specifically it says improved access to and/or increased quality of cultural, recreational, and/or community infrastructure for Canadians, including Indigenous peoples and vulnerable populations. Of these 3 that you're in front of us, which one do you think most qualifies under those definitions? Because I'm assuming the Canadian government's going to be looking at all of those.
I guess you do, Your Worship, to the Council of Honor, would depend which of those ones you wanted to pick out. I think if you're talking about vulnerable populations, it would be the playground, because that would provide variety to different abilities and such. The others, the access to sports covers a variety of groups and organizations, including Indigenous and other, particularly in the South End sports, very important. So it provides more access to a variety of residents in that way. The cultural side, we did not provide cultural projects on this one.
Okay, thank you.
Councillor Martman.
Just add 2 cents then, because I think Councillor Turley is going to want to make a motion. I'm just sharing that I'm leaning towards the Loudon Boathouse, as we're familiar with the aging of the infrastructure, and I'm looking for where we don't ask for too much, but we might be asking for a little bit, so we get more of a bang for our buck over the playground, which actually doesn't require that much funding. There you go.
Councillor Hemmons.
Thank you, Your Worship. Equally, just to share my thoughts, personally, looking at the 3 projects, I think the Barsby Sports Field is what the community could use the most, see the most, users get some access to, but it's above the average number that these grants have given out in the past. The Loudon Boathouse is quite unique, and I think it might capture some interest because of its uniqueness. I'm not a fan of the Maffeo expansion because we just put that in, and I think I was there on Saturday afternoon with my kids. It was bustling. So I think the greatest impact would be the sports field, but I'm more inclined to go with Loudon because it is unique and because it falls within that average. Thank you.
Councillor Brown.
Just a point of clarification. My read of the report says the artificial turf field falls within the average. The average was, what, if I'm understanding correctly from staff, it was 2.5 million was the average award last time, and the ask so it'd be 3.28 million for the sports field? Is that correct? Okay, sorry, my apologies, I misread that.
It's 3.28.
For what it's worth, and I don't mean this in a sexist sense whatsoever, but having heard the Goldilocks approach from Councillor Martman about, not too hot and not too cold and the one in the middle, I'm more of the school of go big or go home. The Barsby Fields would benefit a part of this community that historically, not so much now, has faced some real challenges in terms of poverty and the vulnerability that creates. Their sports teams have lifted the spirit in that neighborhood amazingly, have brought credit and honor to the city. It's part of a much larger project, and I give compliments to previous councils and Mr. Harding and his staff and all those who've worked to ensure that that whole area is becoming a centerpiece for family gatherings and activities where mom and dad can be watching an older kid play in the field and some other kids in the skate park behind. I just think it's a marvelous facility, and it's worth having support. Now, having revealed my cards, in fairness, Councillor Armstrong?
Yeah, for me, I was just going to say I would be for the artificial turf as well. I think it's going to have a much bigger impact. It's used by so many different community members. It will also bring more, could bring more dollars, because right now we don't have enough artificial turfs, and we actually lost out to Ladysmith when it was the BC Football Championships because we didn't have the artificial turf. So I think we can certainly talk about it from an inclusiveness perspective because there's things that could be done for inclusiveness. First Nations, one of the projects I'm working on with KL is to try and find them some more places for soccer and that type of stuff. So for me, that's where my bang's looking at, but I'm not opposed to any of them technically.
Councillor Brown again, before I go to Councillor Turley.
Yes, since we're all revealing our preference here, I too very much am supportive of the Barsby Field one as a first preference. I don't think any of them are bad projects, but I do think it is part of a long-term plan, and it's an important piece. It is really a growing community hub, and it's just incredible to go there. You know, these type of things reduce water consumption, but I think most importantly, there's an opportunity for significant partnerships to hopefully see this project realized, see a big grant for our community, and also probably still seek some alternative funding to lower the city's portion. So that is my preferred project.
Councillor Turley, always a gentleman who let everyone speak, notwithstanding he could have demanded that he be able to make his motion earlier when he got on the list. Over to you, Councillor Turley.
Thank you, Your Worship. So I would like to move that Council direct staff to submit an application to Investing in Canada Infrastructure Program, Community, Culture and Recreation Stream for the Loudon Boathouse project.
Is there a second? Councillor Thorpe.
If I could speak to that now?
Yes, you may.
Thank you. So the good thing about the Loudon Park Boathouse is that there's a group of three groups that have committed to help fund this. And most of us are just waiting for the final report from the city as to what the dollar amount's going to be, or that it actually is going to be a go. And we can start bringing in the Canadian Tires and all the different fund sources that aren't necessarily available to the city of Nanaimo. The other thing that despite what you say, go big or go home, I suspect you'll probably be going home. So, so I think this is one group of sports-minded, and you got to remember, it's not just for sports. They're upgrading the washroom there, and there's a large group of people that do use that beach in the summertime. And I have heard multiple times that the washrooms need repair. So the other challenge we have is there's a considerable membership with regard to the paddling, and there's two paddling groups, and they paddle year-round. And I promised Councillor Thorpe that I wouldn't add my last comment, so I won't.
We're dying with anticipation.
I'll tell you quietly. So.
Councillor Thorpe.
Thank you, Your Worship. I seconded Councillor Turley's motion, and this is a tough one for me because I think Council is well aware of my passion for improving our sports facilities in town, and like Councillor Turley, I've been involved in the sports scene for many, many years here. These are all worthwhile projects, but I'll give you my rationale. The Maffeo Sutton Playground is I think it's undervalued, as I think Councillor Martman indicated, as far as bang for our buck for the grant, and it's something that we're going to be proceeding with anyway. It's already into our budget, and it's, I'll look forward to seeing that completed. At the other side of things, the artificial turf field at Harewood Centennial Park, a couple of reasons that I wouldn't put that at top of my list. First of all, we already do have 3 artificial turf fields in town. I know they're well used, but we've already done a lot to increase our playing surfaces as far as football and soccer, and we've spent a lot of time and money in the Harewood Centennial Park area. And I feel enough attention for the time being has been paid to that particular venue. I think we need to look elsewhere for worthwhile projects. Which brings me to the Loudon Boathouse, and I think it's almost a misnomer to call it the Boathouse because, as Councillor Turley said, this is an improvement to a public facility. It's been in the works for at least 10 years to improve that park. The washrooms and change rooms are in sad disrepair. It's a very, very busy venue, especially during the summer, for people using the beach there. And I think it would be very well used, as well as improving, of course, the facility for the paddling and rowing community. So I think, as again Councillor Martman indicated, it's not too hot, it's not too cold. I'm going for the middle option. I also think it's been in the queue a long time as far as City Council to make improvements at that locale. And I think it's overdue, and I think it's an excellent option. So that will be where my vote goes. Thank you.
Councillor Armstrong?
Just if Mr. Harding can refresh my memory, were we not going to be doing something at Loudon Park for accessibility as well? Did that not come up in the conversation?
Yeah, so if you notice on the design, so it's increasing accessible washrooms, which we don't have right now. So this design will have accessible washrooms to it.
Wasn't there
We'll also be improving, we'll have to move the pier, the wheelchair fishing pier. We'll have to do some improvements to that to get it around the building.
So would make it more accessible for those that are in wheelchairs or scooters or whatever,
Then
correct?
also the washrooms would have standalone
thank you.
accessible washroom.
And also with COVID, it gets people outside, those that have to live in apartments.
I'm going to be very quick and say that I'm sticking with my choice, but I won't be upset if we end up with the Loudon Boathouse. But for that reason, I'm still supportive of the Barsby Field, so I'll be voting against Councillor Turley's motion. Councillor Brock and then Councillor Bonner.
Thank you, Worship. Yeah, I think the Loudon Boathouse is definitely a worthwhile project. However, I think that the best bang for our buck is to get funding for the sports fields at Centennial Park. I think that just a greater number of people will be using that facility. And I think the relationship with the school district and the opportunities that exist there is the best bet. So I'll unfortunately can't support this motion put forward, but I'll be supporting a subsequent one if this does get defeated. Thank you.
Councillor Bonner.
Thank you, Worship. I'm going to go back to the project eligibility again thing. I looked at all three of them. I didn't see any particular three that actually included Indigenous peoples and vulnerable populations. And yes, we can say all of them, Indigenous people can go there, but it's not an Indigenous peoples thing, right? In terms that you can't say, oh, this particular project, that grant application wanted, this is designed so that we can encourage Indigenous culture in our city. None of these are that. Loudon Boathouse will have washrooms. Everybody needs a washroom. That doesn't mean it's including Indigenous people. Even the soccer fields in Barsby, which that's probably where I would put my vote on this one, would be, but it seems like this is an add-on. And I think this is something that we as council and staff should look at carefully and look at, so, okay, the Canadian government put including Indigenous peoples in here for a specific reason, because that's what they're looking for. And we should be obligated, as we are, as part of the Truth and Reconciliation, to look at projects that include this in there. And so I'm just thinking, going forward, this is something we should be looking at as we go through these projects. I think all three are great projects, and I'd like to see all three done, but I'm just probably not going to vote for the motion. Sorry, Jim.
Thank you very much. All those in favor of Councillor Turley's motion for the Loudon Boathouse. Councillors Hemmens, Thorpe, Martman, and Turley. Those opposed? Councillors Brown, Gesselbrock, Armstrong, Krogh, and Bonner. Motion is defeated. Anyone care to make the subsequent and obvious motion? Councillor Brown.
Mainly because I need to try to catch my bus here. That council directs staff to submit an application to Investing in Canada Infrastructure Program, Community Culture and Recreation Stream for the artificial turf field Harewood Centennial Project, and that council commits to funding 1.19 million of the project.
Seconded, Councillor Hemmens. All those, any discussion? Councillor Turley.
Sure, now I'll tell you what I was going to tell everybody. So this motion, in my mind, is from a council that voted on a climate emergency is paving a piece of property that was producing oxygen from the grass. Speaks volumes. Thank you.
Well done, Councillor Turley. Any further discussion on the motion?
Yes, I do, please, Your Worship.
All those in...
Sorry.
Councillor Thorpe.
I do have a question, really. And I'm trying to remember, I have to be careful if this was an in-camera discussion, but my question through you to Mr. Harding is, might there be an opportunity at some future time for the artificial turf field at Centennial, or Harewood Big Field, as I called it when I used to play and coach on it, in partnership with the school district to do some funding and accomplish that project with that partnership?
Your Worship, through the Councillor Thorpe, absolutely. Again, for a number of reasons, we only have the short window to get applications in, so we couldn't go and do all the different work. But the goal would be to work with the school board and come up with a similar, it may not be a 100% agreement like we had at NDSS Community Field, but definitely we want to have a joint use agreement with them for this facility. So the high school will be using it during the day, community using it during the evenings and weekends and holidays.
Okay.
All those in favor? Opposed? Councillors Thorpe and Turley. Motion carries. Thank you very much. The next are bylaws. Zoning Amendment Bylaw number 2019, number 4500.141. Councillor Armstrong.
Zoning Amendment Bylaw 2019, number 4500.141, to rezone 25 Front Street to allow cannabis retail store as a site-specific in the Gateway DT5 zone be adopted.
Seconded, Councillor Hemmens. All those in favor? Opposed? Motion carries. Councillor Armstrong.
It's zoning amendment bylaw 2020, number 4500.172, to rezone 200 Hanson Road from low-density residential R6 and residential corridor COR1 to medium-density residential R8 be adopted.
Seconded, Councillor Hemmens. All those in favor? Opposed? Motion carries. Councillor Armstrong.
It's zoning amendment bylaw 2020, number 4500.178, to rezone 1840 Stewart Avenue to allow cannabis retail store as a site-specific use in the Harbor Waterfront Zone W2 be adopted.
Seconded, Councillor Hemmens. All those in favor? Motion carries. Thank you very much. The bylaw status sheet is for information only. We have no notices of motion, no other business. A motion for adjournment. Moved, Councillor Armstrong, seconded, Councillor Martman. Thank you very much, Council. Welcome
Need a
back.
ride?